Hello guys, can you hear me? इसमें क्यों? हाँ, yeah. Got it. Hello, can you guys hear me? Yeah, very good. See, firstly, we just came to know about the exam and that it has been postponed. So let us be united as FMGs and let's not give up, even though there has been a 60 days gap, like around 60 days, right? What we need to do is make sure that we are on the track. You can go slowly, but make sure you're still on the track, because what happens at this time is because I remember my exam was August 31st, right? I wrote the exam on August 31st and we were supposed to have the exam on June 30th. It was shifted 2 months. And I remember I was that student who had not studied much by 30th June. But all my friends were ready for the exam. They were prepared to give the June exam. And they actually went in the zone where they stopped studying. Okay. I passed because I was very adamant about those 60 days that I got, that no matter what happens, I'll study in those 60 days and pass. They unfortunately failed. So don't become that person who takes it lightly, even if you feel like you have a lot of time to prepare. We have this thing in our mind that it gets even more, because we don't have that thing on the top of our heads, right? That the exam is in 15 days, that the exam is in 15 days, and it will kind of hinder your preparation. But what we can do is we can stay united and we can make sure that we are in this together and we keep helping each other and studying daily. No matter what happens, let's study daily. You guys promise me this. Question tough. See, what we can do is we will be completely prepared for the exam. It doesn't matter what level it is, whether it is tougher or easier. We don't need to care about that, because you remember June exam also was tough, right? But what did we do? We are okay with the pattern now. How much more tough can it get? How much more tough can it get? आप ही बता दो मुझे. Already our level is above NEET, okay? NEET questions are getting easier, but our exam is getting tougher. So it's not like और कितना ही challenging कर देंगे और कितना tough कर देंगे. It will be the same pattern. Please stay with us, stick with us. Let's do it together. No matter what happens, let's study let's make a promise with ourselves today that even if I study for 1 hour, I'm going to utilize all the 60 days that I have. Okay? Can you promise me that? Can you promise me that? See, pattern was changed in August. The questions didn't become tough, but how much more can the pattern change? It has become more clinical. अब क्या ही कर लेंगे उन लोग? अब क्या करेंगे, right? इससे ज़्यादा और क्या कर लेंगे? There can be nothing more than this, right? So please don't get depressed. Let's stay together. Let's do it together. The minute you feel that somebody is with you, you will not feel stressed. All of us, if we are united in this, and देखो unity काम आ जाती है. It will be stronger. We will keep going on. Let's not give up. Let's study. Let's promise ourselves today that every single day I'll do something. Okay? Every single day I'll do something and we will pass together. All right? Don't worry about whether it will be on 4th or afterwards. It's over. Now we know the exam is in Jan. It is on Jan 20th. They can't extend this date. They have already done. जितना करना था कर ही लिया. और क्या कर सकते हैं? Okay? But आप हमारे बच्चे हो, आप strong हो. We are FMGs and you know how much we have faced. ये एक और चीज़ है जो face करनी है. ठीक है, ले लो और कितना ही ले सकते हो आप हमारी, right? So don't worry about it. Just stick together. Stick together. Don't go in that gray zone where you're depressed, you're not talking to anybody. Don't become that person. Please, anytime you feel that you're going in that zone, just one text, okay? I promise you I'll reply to all the text of people who have messaged me, and we will make sure that there is a plan ready. Tomorrow we will come live again and we will make sure that we are with you. See, we are for you, with you. Okay, so we are not leaving you, we are not going anywhere, we are staying here, and since the change happened suddenly, we will make sure that we can do something about it. Okay, so don't worry, we are still there. Let's see about all that. Let's let us inform you everything. Let us sit with each other and decide what to do with you. Okay, so we also need time for that. Uh, wait for our wait for our instructions, right? Regarding any other thing. Don't read any new topics. Just go with the flow. Whatever is being taught, revise that. क्योंकि आप सोचोगे कि let's study more. But what about the things that you're very sure about? You will forget them. So stick to your schedule. Just keep doing that. Keep giving more tests. Keep giving this. Okay, and we are with you. You guys, अभी टेंशन नहीं लेना है. अभी साथ में, like I told you, one thing for one day. Today we will finish PSM PYQs. Let's do it, revise it together like a family. Let's do it. Let's finish it off. And let's see. Our attempt is on January 20th. Why to worry about any other attempts, whether they are going to be there or not there? That's none of your business. Your business is to make sure you pass on January 20th. That's it. Nothing else. Don't listen to anybody. Don't listen to any rumors. Don't go anywhere else. Focus on you, your studies. Okay, and just imagine that once you pass, once the result comes in February, that's it. You're out of this daldal. Okay, this is a bad thing. Being stuck is not easy, but you have been here for a long time and you can do it. अगर अब तक मरा ही है तो और मरा सकते हो. ठीक है, we'll do it together. Let's forget about everything else and let's promise ourselves that we'll study till the day of the exam. All right, so on that notice, let's start the PSM PYQs. And मैं तो ठीक हूँ. I am worried about you and I just want, let's, Balaji, like I told, no attempt matters. What matters is Jan 20th. और कुछ नहीं matter कर सकता. Okay, so my plan was not to take PSM today. Actually, I was scheduled to take on 17 and 18 and I had decided to do paper 1 and paper 2. But now that we have enough time, हम अच्छे से करते हैं और subjects करते हैं, right? तो let's do that. Let's stay positive. साथ मिलके we'll do it. Okay? So 385 students, 400 have joined us, and I know कि news is bad and you are all discussing about it, but at least you people stay with me till the end. Let's finish off PSM. All right? So yeah, I'll send you the PDF right away. तो ये पहला question है and you know the answer of this. I don't think I need to say a lot about this question. You know it already. We will help you with the planning, the schedule for your exam, how to approach it. We will be there for that. So let's not, yeah. So everybody knows this is the program for dots, right? This is the program for dots and we are not going to spend much time on it. ये देख लो, ये दूसरा symbol है. This is another symbol and this is easy, okay? First 3 easy questions. I'll share the PDF after the session, all right? I'll share the PDF after the session. देखो ये गर्म पानी दे दिया मुझे, बहुत गर्म. Yeah. Okay, great. This is, and what about if this becomes red? If this becomes red, then that is, yes, it is AIDS. Okay, what is the program for AIDS that we have? What's the program for AIDS we have? That also you tell me. All right, so this is for breast cancer. We know and this one, this is nothing but your leprosy, right? This is leprosy. This is leprosy, right? So let's go to the first question. Look at this. For a population of 10,000, the sex ratio is more than 1,000. Identify the correct statement from the following. Okay, so whenever such questions come, you need to remember that we are talking about a ratio. And the ratio has a numerator as well as a denominator, right? तो हमें ये देखना है कि what is the numerator in this? Can you tell me what is the numerator? How to approach rumors? Social media काट दो. That's the only thing you can do, and try not to interact. Whenever somebody talks to you about rumors and भाई ये हो रहा है, भाई तूने ये सुना क्या? Just tell them I'll study. Okay, what's in your hand? पढ़ाई आपके हाथ में, और कुछ नहीं है आपके हाथ में. What will you do with the rumors? बस time waste होगा. तो don't do that. All right? Yeah, December exam is postponed. Now it has gone to it has gone to January, right? So when we are talking about this question, remember what is the numerator? And whenever there are ratios, think about what is the numerator and what is the denominator. So here, when we are talking about sex ratio, we always equal the numerator as yes, it is as females, right? As females. Females by males into 1000. Okay, so here look at the question. The sex ratio is more than 1000. So that means females, which is the numerator, is more than 1000. Okay, for a population of 10,000, it should be 5,000 females. It is equal to 5,000 males. But now what are they saying? The females are more. So 5,000 females compared to, so by logic, how should be the males? The males should be less than 5,000. Very good. Males are less than 5,000. Look at the question again. A population of 10,000 is given. Out of that, you have to take what is the numerator. So sex ratio means females. Females are more than 1,000. That means for a population of 10,000, 5,000 females are more than 5,000. So males will be less than 5,000, right? Yes. Yes, it has been official. All right. Now look at this question. Look at this question. Don't worry, we are there for you. बोला था ना, end तक साथ देंगे तो end तक साथ देंगे ही आपका. Okay. So look at this. This is the topic where a lot of questions come. So we need to make sure that we are very good with this topic. When we are talking about civil registration system, what is the civil registration system? It involves three things: the birth rate, the death rate, and the marriages, right? The marriages. When we talk about sample registration system, can you tell me what does that involve? What does that involve? What does that involve? Okay, let's come back, let's study and make sure we are done with PSM. Yeah, tell me, what does that involve? Like I said, your birth and death rate as well as your marriages are involved in which? Civil registration system. What about your sample registration system? It includes the crude birth rate, the crude death rate, and the infant mortality rate. So it is involved with morbidity, right? The mortality. So it includes what? You have to remember, it includes crude birth rate, crude death rate, and infant mortality rate. And what does your National Family Health Survey include? Remember, firstly, it is a large scale survey. It is there for state level as well as national level, and it involves the family planning as well as the child mortality. Okay, so if you remember the keywords of this, that is enough, right? That is enough. So civil registration system, three things I told you: birth registration, death registration, and marriages. What about your sample registration system? Now that involves the crude birth rate, the crude death rate, and infant mortality rate. What about your National Family Health Survey? That involves the mortality as well as family planning. Now answer this. Sample registration does not include, and these are all your PYQs from various sessions, and they have one question is sure from this topic. Okay, I'll send the PDF after the session. Very good. It does not involve the maternal mortality rate. Again, you remember, what does it involve? The crude birth rate, the crude death rate, and infant mortality rate. What about your MMR? Do you know your maternal mortality ratio? Maternal mortality ratio. Now that is also a MCQ in itself. What is the numerator? What is the denominator? And multiplied by how many? Multiplied by how many? Can you tell me that? So that is number of maternal deaths by number of live births births. Very good, very good. So this is a PYQ itself into 1 lakh, right? So this is another PYQ, all right? Yes, I will send the PDF. Now look at this. Which agency collects, publishes large scale surveys? I told you, large scale surveys. So you saw the question which we did first. It had 3 explanation and all of them have been asked as questions. So large scale surveys, morbidity, family planning. Again, what is this now? Yes, it is National Sample Survey or National Family Planning Survey, right? Let's go to the next question. Again, one question that has been asked very frequently in your exams, and I'm sure this will come in your January exam as well. Yeah, it has been postponed because of the elections, but let's not, why do we need to care about that, right? Very good. So for understanding or solving such questions related to this, you have to make sure that you're okay with this table. And what do you have to see when we are talking about demographic model? What do they have? The birth rate, the death rate, and the population overall, right? So when a country comes in its first phase, you remember the birth rate and the death rate. Wherever high or wherever low is there, remember they are both high and they are both low. So phase 4 and phase 1, high stationary and low stationary. Both of the birth rate and death rates are high, as well as stage 4, both of them are low, right? Right? So now look at the second phase. What happens? Your stage 2 or phase 2, it is early expanding, where the death rate are declining. They start declining in the second stage, but your birth rates are still high. What about stage 3? Death rate is already declining, but birth rate starts declining now. And stage 4, I told you it's low, while your phase 5 is where your birth rate starts declining, where your death rate is maintaining a low level. Okay, can you give me examples of countries where we have, which are in stage 5 or phase 5? Can you give me examples of countries which are in phase 5? You remember the countries which are in phase 5? So these are the countries like Singapore, Russia, right? Japan. What is happening? The birth rate is declining further while the death rate is low. Okay. So with me, remember the first phase. What was the first phase? What was the first phase? It was high stationary. And what were the birth and death rates? Both were high. What about the second phase? It was early expanding, where the death rate had begun declining, but the birth rate was still high. Now the third stage, what was the phase? Late expanding, where India is currently in. Birth rate starts declining while your death rate declines further. Finally, you have the low stationary, which is both low, and then you have fifth stage, which is the declining stage, where your what happens? Birth rate is declining while the death rate is low, right? Very good. So now look at this question. Tell me the answer for this. Identify the image, and you have to remember it in the form of a graph as well, right? You have to remember it in the form of a graph as well. So can you see what happens in the first stage? Birth rate and death rate both are high. Then which one starts declining? Can you see the death rate starts declining while the birth rate still remains high? This is stage 1, this is stage 2, this is stage 3, 4 and 5, right? Then what happens? Death rate starts declining while birth rate is still declining, and finally both become low. And then can you see the birth rate declines even further while the death rate is low, right? Can you give me a yes if you're all with me? So yes, what is the answer for this? This is nothing but you can see the transition of the population from stage 1 to stage 2. So this is nothing but your demographics transition model, right? Very good, very good. Now look at this question. Now solve this for me because I've told you how it is. Tell me, solve this for me. Solve this for me. In a European country, there are low births and high deaths reported. Which stage of demographic cycle will be present? Okay. Yeah, very good. So this is your declining stage. Why? What happens to birth rates in declining stage? They are declining. while your death rates are while your death rates are while your death rates are low. So birth rate is lower compared to death rate. That means low births and high deaths, right? Low births and high rates. So yes, this is the declining stage. Now look at this. Demographic gap attains its maximum limit in. So they're talking about the gap between the birth rate and the death rate. And now look at this. Can you see? This is your stage 1. This is your stage 2. This is your stage 3, 4, and finally 5. So can you see that the maximum gap between the birth rate and death rate, can you point it out for me? Where is the maximum gap present? This is the maximum gap between the birth rate and death rate. So now can you tell me, where is it? Yes, it is in stage 2. Which part of stage 2? Is it the early stage 2 or late stage 2? Look at it again. Is it the early stage 2 or late stage 2? Look at it again. This is your early phase. This is your late phase. So now tell me, yeah, very good. See, now you know. Now you know it is late stage 2. Now look at this. True about late expanding phase of demographic cycle. Whenever such question comes, you remember late expanding is which stage? It is stage 3. So now let's rule out together. Birth rate is lower than death rate. Is that true? What happens to your death rate? Death rate is already declining and birth rate starts declining. Right? Birth rate starts declining. So now, with this in mind, can you tell me what happens first? Birth rate is lower than death rate. That is not possible. Death rate begins to decline while birth rate remains unchanged. Is that true? No. Death rate declines still further while birth rate tends to fall. Right? We remember this. If you know the table well, if you know these two things well, any question can get solved. Right? Okay. Actually, my PYQ, now tell me this, contraction of they talked about gap first, and now they're talking about where the contraction, where both birth rate and death rate are becoming closer. Okay. So again, look at the graph and you remember what happens to the death rate. They become closer to each other in which this is the third stage. And can you see now they are becoming closer to each other? Can you see? Now they are becoming closer to each other. So which phase is this? Yes, very good. This is your early stage 3. Okay, early stage 3. All right. So now look at this. This is the last question related to this topic. So we are sure with this topic we can get one question for sure in your exam, right? Now look at this. Which of the following is known as a demographic bonus? Increase in population. आप खुद देख रहे हो इंडिया में क्या हो रहा है, तो is it helping in any way? No. Increasing in population does not help in any way. Decrease fertility. You can see what is happening in Japan or Singapore. What is happening? The females have decided they want to work and they want to get educated. So what are they doing? They are not, what do you say? Old people will be more compared to new generation, right? So no, decrease fertility will not help. Increase in dependent population is nothing but your children and your old people. Again, they are dependent, they will not help. So yes, productive age is our age. And that's how, if you pass, you can be productive and make sure that you help the country in some way or possible, right? Very good. Now look at this. In which is India in? I think no explanation is required for this. You all know it is in the late expanding, right? Yes, very good, Shubh. You all will pass. You all will pass. Now look at this. Mid-year population is taken on. Mid-year population is taken on. Yes, it is late expanding for India. Mid-year population is taken on. हाँ गाजी वो तो है, country help नहीं कर रही because we are FMGs, right? We did not help pay taxes. तो ले रही है हमारी. Yeah, very good. Very good. It is July 1. Very good. So you are all on track. Now tell me about this. Tell me about this. Most popular fertility indicator among the following is. Most popular fertility indicator among the following is. Yes, very good. It is TFR. So this is another topic where question is 100% sure to come. So you have to remember the explanations of that. And for that, what do I want you to do? For crude birth rate and crude death rate, just remember that we divided per mid-year population, right? Per mid-year population. It is nothing but crude birth rate is number of children born. Death rate is number of deaths that occurred. Remember, it is mid-year population. What about your TFR? If they ever ask you average number of children born to a couple or a reproductive female, and what is the reproductive age? We all know it is what? 15 to 49, right? So your TFR, it is the average number of children born. Then your gross reproduction rate and your net reproduction rate is related only to females. Okay. TFR for average number of children. Your gross and NRR related only to females. Right? ठीक है, वापस आ जाओ. लेट्स हम एग्जाम बॉडी को गाली बाद में देते हैं, अभी पढ़ लेते हैं, उसके बाद जब सेशन एंड होगा मिल के गाली देते हैं. All right. So अभी let's focus on this. GRR is what? It is the number of daughters born to a woman in her reproductive lifetime. In her lifetime or reproductive lifetime. What is NRR? Again, it is number of live daughters born to a female in a reproductive lifetime considering the mortality. What do you mean by mortality? It is how many of those girls were either how they died. Okay, so mortality was taken into consideration in NRR. All right. So again, what are the fertility indicators? You have your TFR, which is the total fertility rate. And what are we considering? Average number of children. What is the most popular indicator? Again, TFR. If they ever tell you, where can you see complete family lives? Complete family size. That is also TFR. Complete family size, that is also TFR. Okay, can you remember this? Can you remember this? Now let's do it again. TFR, what is TFR? Everybody say with me. Average number of children born to a female or a couple in their lifetime. What is GRR? Which is nothing but gross reproduction rate. And GRR, NRR, girls. Okay, so we are considering only girls there. क्योंकि हम तो special है. तो GRR is number of daughters born to a female in her lifetime. NRR is net reproduction rate, which is number of daughters born to a female in her lifetime, now considering the mortality. Got it? Now tell me the answer for this. Mortality is taken into consideration. We just did it. We just did it. It is NRR, right? It is NRR. Now look at this question. What is net reproduction rate? Again, all your PYQs, NEET, FMG, I've just kept it down here and you can see all the questions have been asked there also, here also, but the same question, right? So number of female children born taking account of mortality, right? Now look at this. Average number of children that were born to a woman if she experiences the current fertility pattern throughout her, assuming no mortality. So what is the answer for this? Assuming no mortality, we learned it. It is GRR. Very good. No, it is GRR. Gross reproduction rate. All right. And what about your GFR, which is general fertility rate? Number of live births per 1,000 women in her reproductive age. Okay. Number of live births per 1,000 women in her reproductive age. Now look at the next question. What is your general fertility rate? What is your general fertility rate? Now let's solve this question together. It is number of live births per 1,000 women in a reproductive age year. Yes, this is true. It is a better measure of fertility than crude birth rate. Now when we talk about crude, which oil do you use for cooking? Crude or refined oil? Crude or refined oil? You know, you use refined oil. So crude is anything that is very rough. So anything is better than crude. right? So this also should be true. If two are true, means all are true, right? So every question you solve it accordingly, you solve it ऐसे, और आपको it will be easier to solve. If you rule out and you're able to say, no, this cannot be the answer, this cannot be the answer, you'll be able to do it nicely, okay? So now let's go to the next rate. Total fertility rates of 4 cities are given. 2.1, 2.6, 2.7, 2.8. Which of the following has achieved desirable TFR? Very good, Ajay. Very good, Vani. Very good, Himanshu. Life of Coopers. Thank you, Paras. Thank you so much. So I know that many people have left and many people are not able to study at this point. But people who have stayed back, thank you for staying back. Let's do it together. Yes, it is 2.1. The desirable TFR is 2.1. What about India? India, where is India? What is the TFR of India? What is the TFR of India? What is the TFR of India? So we know it is 2. Actually, it has been changed. So check it, please. Because as far as I know, one of the faculties have told 2 for me. Okay, they have told 2, but please go through it, check what have been taught. Now look at it. The average number of children. See, if you are able to do, I told you, no, one question you do all the explanation, all the MCQs are easy for you then. Okay, let them ask anything. We are ready, right? So what is it? TFR. Got it? So 3 marks for sure, short, we are done with in PSM. And we know it's going to come in the exam, right? You can see these are every year MCQs. I just combined it together. I combined it together because I know I was seeing the book and I was saying these are the MCQs which were taught every year. So why not just combine them, right? Make life easier. Now look at this. Shown contraindications of the device shown in the image include. Firstly, look at the device. What is the device? Name the device. Can you tell me what is the device? Thank you, Ajay. Thank you. PDF मिल जाएगा, group में भेज दूंगी मैं. Tell me the name of the device. I don't want to. Yes, it is copper T. Which one? It is not multi-load. Multi-load looks like this, na? It has flexible arms. Multi-load has flexible arms. Copper T, which one? 380. Copper T380 has this. The copper T380A has copper on the arms. You can see no copper on the arms, no? So what is this? Copper T375, right? Copper T375. Mirena में copper थोड़ी होगा. Okay, should I show you the images? Wait, I'll add the images here. So this is copper T375. Copper, how is it? Copper T375. 375 is the surface area. T is the shape of copper T and Cu is it's made of copper. So what is the lifespan for this? Can you tell me the lifespan? What is the lifespan? Yes, this is 10 years. Okay, 10 years. And this is another question that they ask you. Multi-load looks like this. Okay, please don't confuse with multi-load. It looks like this. It has flexible arms. It is multi-load 375, right? So yes, what is the lifespan of multi-load? What is the lifespan of multi-load? Now multi-load is around 3 to 5 years, right? Multi-load is around 3 to 5 years. So now they have asked you the contraindication. In contraindication, again, 2 questions were asked. This is PID. So look at the absolute contraindications. Pregnancy, you do not give it in pregnancy, PID, but any vaginal bleeding or cancer. Okay. What about relative contraindications? And these are absolute. So no, you cannot give. Okay. What about relative? History of PID, anemia, menorrhagia, uterine malformations. Can you give me an example of uterine malformations? We know about your septate uterus, your bicornuate uterus. Those are your uterine malformations, right? Fibroids. What is the other name of fibroids? What is the other name? Tell me the other name. Leiomyoma, right? So fibroids, those are relative. So you remember the absolute contraindications. Again, what are the absolute contraindications? Say it with me. Pregnancy, PID, any unexplained vaginal bleeding, cancer. Okay, the 4 you remember, right? Very good, very good. Relative means can be given. Absolute means no matter what, not given. All right? So that is the difference. Now look at this. ये तो सबको पता है, and you see, ऐसे questions can't we solve? Can't we solve such questions? You tell me, आप इसमें जाके गलत करोगे क्या? So that's not possible, right? Yes, so this is your, very good. Now tell me, what is this? What is this? Let's do all 4 options, right? Ectopic pregnancy has been removed from absolute contraindication, okay? Look at this. Yes, this is your diaphragm. All right, this is your diaphragm. Now, what about this one? Look how happy she is. She's like, चलो मैं अपनी fertility अपने control में रखूंगी. This is your female condom. Okay, female condom. Though I've never seen anybody use it. What about this one? This one is very famous. All of us have seen this. Okay, this is your male condom. ठीक है? Male condom. You can see it in the wallet of guys. All right, this is your male condom. This is your vaginal sponge now. This is your sponge. Okay, this is your sponge. So 4 images done. Diaphragm, female condom, male condom, and sponge. Right? Very good, very good. Yeah. Now tell me this. Tell me this. A screening test is done in India. In the image given below, what does BC represent? तो BC आपकी गाली नहीं है, ठीक है? BC you should see from here and identify. Yeah. Okay, many A's and many people saying A, some saying lead time. So remember, what is A? A is the time the disease has started, and you have to remember this. Disease started, okay? First possible detection. Then what is C? This is your critical point for C. Point. What is D? D is the usual time of diagnosis. And then finally you have the outcome. Now in this question, screening time should be, see, critical point is when your symptoms start beginning. But they get so worse that you as a person would go to the doctor. Ki, this is going so bad, now what should I do, doctor? So usual time of diagnosis happens when the patient goes to the doctor, right? And the symptoms get worse here. Now from this point, till what time can I find the disease? Till here. Okay, before this, I cannot diagnose the disease. Why? The disease has started, but it can be possibly detected by B. With all the screening tests that we have, with all the diagnostic tests that we have, we can only detect the disease by the point B. Okay, so you have to lead against the diagnosis, right? And leading against the diagnosis is the point D. From D, how long can you lead? Till B. So BD is nothing but leading time. And screening should be done when there are no symptoms present, right? So symptoms start at critical point. So before that, till this point, from this point till this point, what is it? BC is your screening time. Okay? BC is your screening time. Again, I'm telling you once again, the disease had started from point A. But when can you as a doctor possibly detect it? From point B only you as a doctor can detect it, right? So your usual time of diagnosis is D. From D, how long can you lead? How early can you find the disease? So if you can find the disease here, you can find the disease here, you can find the disease here, you can find it here, you can find till B. Before B, there is no possible detection, right? So B to D is your lead time. And critical point is where the symptoms will start. Any screening is done before symptoms, right? So B to C is screening time. Everybody with me? Everybody with me? Thank you, Dr. Hoffman. Did you understand? Give me a yes, please. Did you understand? So again, screening time, BC, or lead time is only these things they ask. IP, incubation period, what will they do by asking you? They will ask you the incubation period of diseases like measles. Measles का ले लो incubation period क्या है? 10-14, right? 10-14. So they will ask you the incubation period of this. Here they will only ask you about screening time and lead time. All right? Very good, very good. Now let's go to the next question. Like I've put it here. So this is another question that is 100% sure in your exam. One pneumonia ka question आएगा ही आएगा. Okay? It can come as a part of medicine. It can come as a part of surgery. But it is surely going to be there. No, surgery, medicine, where else? Pedia, PSM. Okay, it is an integrated part. So you have to keep it. So a 3-year-old child presents to the PHC with fever. He had chest in drawing, respiratory rate. So can you see what is the diagnosis? First diagnose the child. The diagnosis with chest in drawing is severe pneumonia. Okay? It is severe pneumonia. When do you say it is only pneumonia? When do you say it is only pneumonia? When do you say it is only pneumonia? Okay, so what will you do in severe pneumonia? You are not going to treat the patient. You give the antibiotics and refer to tertiary care. So like I said, one good thing I did with my classes is that I make sure that we have enough tables to go through. Okay, so remember, when we are having fast breathing, okay, fast breathing is considered pneumonia. This was another question that somebody had posted in one of our groups. Can you see this question? Can you answer this question for me? A 3-month-old baby is brought with complaints of fever and fast breathing. Now tell me what is the answer for this? What will you diagnose it as? What would you diagnose it as? Okay, so check out what the patient has, and usually they will tell you the signs and symptoms this way. Okay, very good. This is pneumonia. This is pneumonia. Why? Fast breathing. If no fast breathing, it is not pneumonia. It can be other respiratory illness. So just guide the patient, advise the mother, and make sure supportive management. Okay. What if there is nasal flaring, chest and drawing, stridor in a calm child? These are all symptoms of severe pneumonia. What would you do? Give antibiotics. If it is not pneumonia, if it is anything more than pneumonia, always give antibiotics, refer to tertiary. Another question that comes is, where will you do follow-up of the patient? So can you tell me, where will you do? Which phase of pneumonia will you do follow-up of the patient? Can you tell me? Can you tell me? Which phase of pneumonia will you do follow-up of the patient? Remember, it is pneumonia. See, follow-up of a patient you can only do if the patient comes to you. So if you're treating the patient in PHC itself, only then the patient will come back to you. If you're referring the patient to tertiary care, will the patient come back to you? Ki nahi, aap hi treat kar lo वापस? No, that will not happen, right? So follow-up for pneumonia. Severe pneumonia, no follow-up is required. Why? You have referred the patient to tertiary care. तो उनको देखना है, आपका कुछ लेना देना नहीं है उससे, right? तो pneumonia, for pneumonia only, where fast breathing is the symptom, you will do follow-up. All right? Symptoms. Look at the symptoms. When can you say it is? When the patient the baby has nasal flaring, grunting. In the clinical question, they'll give you, this baby was brought flaring. On examination, stridor was seen in a calm child. Got it? Now let's go to the next question. ये तो easy है. What is the answer for this? Very good. So what is the answer for this? Very good. This is your histogram. So with histogram, what do you have to remember? What kind of data you're going to see through a histogram? So what kind of data? Quantitative, right? The same thing applies to these two, while your bar diagram is qualitative data. right? It is qualitative data. Okay, so now tell me, what is this? What is this? Can you identify the images? And what we are doing is we'll cover images also, so that both are done. PYQs plus images. What is this? This is not an ogive. Today we will solve it together, and today we will remember it. This is a polygon, right? This is a polygon, frequency polygon. This is a frequency polygon. What about your ogive? What does your ogive look like? This is your frequency polygon. Okay, frequency polygon. What about this one? This is your scatter plot. This is your scatter plot. Okay. What about this one? This is your bar diagram. Yes, I will post the PDF. Don't worry. आपकी मैम कहाँ जा रही है? You have us on integrated learning. So where am I going? I'm not going anywhere. So don't worry. PDF I will give you. Okay. Now I'll show you some more images. Let me just show you some more images so that we remember it better. Look at this. What is this now? What is this? Can you see? What is this? What is this? I'm sorry, it's already written. This is your ogive. Okay. How do you define an ogive? How do you define an ogive? An ogive is anything that whose frequency goes up. Okay. Why is this not a line chart? Frequency will go always up. Okay. Can you see the frequency is going only up? So anything that goes up, that is ogive. Ogive, or it is also known as frequency, cumulative frequency diagram. All right. Frequency only increases. Now look at this. This is your histogram, right? What happens in a histogram? They are all related to each other. And what kind of data is it? It is continuous quantitative data. All right. Now look at this. Now tell me, what is this? What is this? Can you tell me what is this? What is this? So देख लिया कितनी मेहनत करते हैं आपके लिए. Okay. How do you know this is line, or how do you, can you see what is the difference between ogive and line? Look at ogive, the frequency will go only up. Okay. Ogive, the frequency will go only up. What about line? Can you see the frequency has gone up? Look at this. I'm marking it here. It has gone up, then it went down. Then it went up again, then it went down, then it went up. So it is going up and down. And because it is going up and down, it can predict the trend of a disease. Remember, COVID happened. So what did you do? What did you and I did? We went to the news channel. We were saying, jitne cases hai. Look, how many cases today? Then how many cases? Now, take it on a graph. These many cases today, this down, that down. That's why it can depict the secular trend of a disease. राइट. कोविड में ही भाई यही किया था ना, लाइन चार्ट किया था, देखा था. एवरी डे वी वर वाचिंग, टुडे दिस मेनी केसेस, टुडे दिस मेनी केसेस. यू रिमेंबर दैट? So yeah, this is your line chart. Frequency goes up and down. Where frequency goes only up, that is ogive. What about polygon, frequency polygon? Look at frequency polygon again. Look at frequency polygon again. This is your frequency polygon. It is a shape of a polygon, right? So this is your frequency polygon. Anything going only up is your ogive, and one thing that goes up, down, which depicts the secular trend of a disease, which was your June 22 to PYQ. Okay, so that is a line diagram. Got it? Got it? Everybody with me till now? Movie dekh. Okay, so this is your scatter plot, this is your bar diagram. All right. Line, just remember it in a simple way. If I have, what is this? What is this? Frequency is going up, going down, going up, going down, going up, going down. What is this? Frequency is going only up. So only up, ogive, down, up, line chart. All right. Just remember it like that. No, don't overcomplicate it. Okay, you have to remember the images, and that's why we will remember it just like that. Another question, very, very important question for your exam. Look at this. A 2-year-old child has recurrent candidiasis and respiratory infections since the past 3 months. Okay, what is the answer for this? So any child that is immunocompromised, any person, any child, any person immunocompromised, okay, immunocompromised, or immunocompromised or pregnant. What vaccines are contraindicated? Absolute contraindicated? Live vaccines. Very good. So what are your live vaccines? What are your live vaccines? We have to remember the live vaccines first. Remember TT and TBT, DPT, they are both toxoids, right? These are toxoids. While your killed IPV is killed, right? So how do we remember our live vaccines? So there are many mnemonics for this. Okay, these are your live vaccines, while these are your killed and these are your toxoids. I've written them down, but how do I remember them? I'll show you. So I remember them as 2, 2 and 3. All right, 2, 2 and 3. So what I do is, we know one vaccine which is live but can be given in pregnancy. Which one? Can you tell me which vaccine is live but can be given in pregnancy? So you remember that is the yellow fever vaccine. And the other question that came for yellow fever vaccine is, what is the lifespan? So it is for lifetime. Both of these are MCQs, you remember? Both of these are MCQs. So you remember it like that. Firstly, 2, 2 and 3. So MMR, which is nothing but measles, mumps, rubella, which are written here. Measles, mumps, rubella. Then you have plus yellow fever, BCG, OPV, which are given at your birth. Okay, birth. And then finally JE, rota, varicella. All right. So if you remember it like this, it's easier. MMR plus yellow fever. What is given at birth? BCG, OPV. Then finally, what are the three? Rotavirus, JE, rotavirus and varicella. Okay. So if you ऐसे याद करोगे तो याद रहेगा. I remember, because if we put a lot of mnemonics, what happens? We forget the mnemonics. So remember it like this: 2, 2, 3. Okay. Are you guys still with me? You can remember however you want, but I remember it like this because in that way I'm able to solve more questions. Like BCG, OPV plus Hep B, they are given at birth. I remember it with that. Then MMR 9 months, yellow fever lifespan is 10 years, but it can be given for pregnancy. So I've kept them at a level where I can solve more questions. Okay, so you can remember it as you want. मैंने ऐसे याद किया. So 2, 2, 3. MMR, your yellow fever, BCG, OPV, JE, rotavirus, varicella. And I remember it even now because I remembered it like that. Okay? Now look at this question. This question, tell me the answer for this. आप लोग मेरे साथ रोकोगे? Should we finish all the PSM PYQs? Yeah, you want a break? Like, should we do it in parts? NLC की कब? Okay, thank you for being there for me. Thank you. It means a lot seeing you live, even though we have had such a bad news. But I'm so proud of you people. Thank you. Thank you for being there. Let's do it together. Okay? Yeah, very good. A person contracted malaria. So what I want you to remember, how can we rule out even without knowing the options? First, we will solve the answer. What is the drug of choice for Vivax and Ovale? What is the drug of choice for Vivax and Ovale? Please tell me this first. What is the drug of choice for Vivax and Ovale? What is the drug of choice? I know किसी का मन नहीं लग रहा, पर let's do it. Let's do it. Very good. It is chloroquine. Okay, very good. It is chloroquine. And now look at this question. What is written? The presence of falciparum. And you know falciparum is the most common kind of malaria that we have. Okay, falciparum and malaria are common in India, right? And what is the drug of choice for both of these? What is the drug of choice? It is ACT. Now ACT is divided into northeastern state and it is divided into other states. Okay, northeastern we give lumefantrine, we add ACT plus LM, and other state we add SP, right? So if you know this much, any question can solve. Any question you are able to solve it. Now look at the options. They said falciparum. So can I rule out any option with chloroquine? Let's rule it out. What is the other option? Quinine. Quinine is not so important. It is actually related to resistance. What you need to remember is chloroquine and ACT. One of the derivatives of ACT is your artesunates. So the answer becomes simple. It is artesunates. So just remember this. Remember this. And yeah, chloroquine. What is the other thing? It is a drug of choice in pregnancy. What is the one thing that chloroquine causes? Bull's eye maculopathy. We are going towards ophtha, right? So let's integrate all subjects and let's do it like that. So quinine, it is used in falciparum infection resistant to chloroquine. Doesn't matter. We don't need to know that much, but this is important. What is the drug of choice for falciparum and malaria? ACT. In northeast, it is LM. In rest of the India, it is SP. Okay, it is SP. Chloroquine is the drug of choice for non-falciparum like Vivax and Ovale, right? Like Vivax and Ovale. And it is used in rheumatoid, drug of choice in pregnancy. You all know, right? You all know that. Now look at the next question. There are 30 people in a camping site. Which of the following is the best method of disposal of waste generated? Can you answer this? So again, one more time. Malaria, very important for the exam. What is the drug of choice for Vivax and Ovale? It is chloroquine. What is the drug of choice for falciparum and your malaria? ACT. Now, ACT is divided into northeastern and the rest of the India. Northeastern we have, what do we have? LM. And for rest of the India, it is SP. Okay? All questions solved just based on this. And chloroquine causes bullseye maculopathy. Don't forget that also. That is important. Okay? Now tell me the answer for this. See, they asked you dumping. Many people are saying dumping. Remember, there are, the rich ladies that have gone zero waste and all. Have you heard of them? That they are like zero waste, so they are doing composting. Composting, if you remember your 5th standard, EVS, we used to have. So you remember humus or organic matter. So any organic matter which is related to kitchen, right? If we put it in a compost, that whatever we get is useful in soil, nourishing the soil, right? So that is composting. Can you do it at a camping site? That is not possible. Okay, dumping is nothing but the most unhygienic method. Okay, this is the most unhygienic method. Why? Have you seen those bins outside? All the bins which the vehicles take, the bins जो अपने इंडिया में भरे रहते हैं, but never the garbage is inside. It's always outside. They take it and throw it outside the bins, right? That is dumping. Okay, and remember, why is it most unhygienic? Because it is open. So what will happen if you're dumping it in the waste bin? That waste bin is also kept open. So what will happen? It will attract mosquitoes. It will attract flies, right? It will attract flies. So yes, this is very unhygienic. Okay, this is very, very unhygienic. What about control tipping? Control tipping is where you dig a very, very big hole. Okay, itna bada hole banaya, and you put all the waste in that hole and you then cover it with soil. All right. So this, can you see this? Can you see the hole that is made? Can you see the big hole that is made? This is control tipping. Now, if I put soil, this is known as, and this is the best method. But can a group of 30 people do this? Can they dig such a big hole and will they have this much kachra? No. So the best is burial. It is digging a small hole. You put it inside, you dig a small hole, then you put the garbage inside and cover it. All right? So everybody with me? Everybody with me? So control tipping is the best and the most hygienic method. But what is the drawback? Do we have enough space? India is densely populated. तो इतनी जगह है कि हम गड्ढे खोद कर हर डाल पाए? No. That's why the most common is dumping. But the best is controlled tipping. The best for a group of 30 people is burial. This is done in forest usually, right? Camping में करते हैं हम लोग. All right? Chalo. Now look at this. Look at this next question. According to WHO, maternal mortality is defined as. होल से आप बहुत कुछ सीख सकते हो. ओके, होल से ही निकलते हैं, होल्स के बारे में पढ़ते हैं. ठीक है, बहुत कुछ सीखने मिलता है. Okay, so what is the answer? Yeah, so many people have given A, and yes, it is A. Okay, antenatal period till, I told you, what was the MMR? Maternal mortality. Firstly, it is a ratio. Okay, that is the one thing you remember. It is a ratio. What is the numerator? Always think of numerator and denominator. So number of maternal deaths. And which maternal deaths you will count in which period? Antenatal, which is the pregnancy, plus the puerperium, which is around 6 weeks. Okay? So pregnancy till puerperium, which is around 6 weeks, where you get better, right? So antenatal plus 6 weeks. Okay? Delivery plus 2 weeks doesn't make sense only, and during delivery again doesn't make sense. All right? So again, antenatal plus 6 weeks postpartum. So remember, अभी तक तो इतना ही. if there is any, as far as I remember, this is the answer, but if there is any update, I will let you know. Okay, I'll let you know if there is update. All right, as far as I know, this is the antenatal till 6 weeks was the answer. So if there is an update, I will ask the faculty and let you know. Now let's go to the next question. Now, more than one doctor's opinion is required as per the latest. So you remember, when did the guideline comes? That is another question. It came in 2021. Okay, it came in 2021. The other thing is, do you remember ki before 2021 what was the case? Before 21, let's do MTP Act. Okay, so we can divide it into before 2021. Okay, before 2021 and after 2021. So what was the case? One doctor till how many weeks? One doctor. Here it was till 12 weeks, and here it has become till 20 weeks. Now two doctors, before it was told for 12 to 20 weeks. Okay. Now it is told 20 to 24 weeks. So read the question properly. See the guidelines. What if they ask you as per the old guidelines? What would be the answer then? It is up to 20 weeks, right? If they ask you the old guidelines, the answer is B. If they ask you the new, then the answer is yes, up to 20 to 24 weeks. Okay? Yes, Rahul, आप सो रहे थे. आप सो रहे थे, अभी जगे हो आप. हो गया. Postpone हो चुका है. Okay? So this you remember and solve the question according to the question. ठीक है? जैसे question आया वैसे solve करना है. All right? Now let's go to the next question. Which of the following is not a health worker provided at the village level? Which of the following? Which of the following? Thank you, Junaid. Okay, very good. It is ANM. And what is ANM? This is your Anganwadi worker. What is the full form? That was another 2018 question for FMG. Okay, they asked, they were like, अरे इनकी लेते हैं आज. Let's ask the full form. आशा बहुत करते हैं. Let's ask them what is Asha. So Asha is nothing but अरे क्या एंजाइटी लेके करोगे, लेट्स हंसते हंसते खेलते खेलते पास करते हैं. ऑलराइट, accredited social health activist. Very good. So now what we have to remember is this. Okay, this is your Asha, this is MPW, village health guide, your what is this, this is your traditional birth assistant and Anganwadi worker. So where they are posted and how much population, very, very, very important. So Asha, remember it is 10th pass, but can we decrease it to 8th if they meet all the other criteria? You tell me that, because that question has been asked also. Okay, can you tell me? Can it be decreased? Yes, it can be decreased to 8th grade. It is usually 10th grade, but if it meets all the criteria, we can decrease it to 8th grade. ऐसे मत बोलो सालिक, सालिक अर्शिद, मेरा आशा ही खत्म हो गई. नहीं भाई, नहीं करना है आशा खत्म. लेट्स स्टे यूनाइटेड. पीपल मोटिवेट हिम. डोंट डू दिस. लेट्स स्टे यूनाइटेड. डोंट आशा खत्म हो गई मत बोलना. Okay, Asha, where does it stay? At village level. What is the population? 1 is to sorry. 1 is to 1000. And how much, what is the criteria for her education? Should be 10th path, but can be decreased to 8th. Okay. MPW, where is it? At sub-center. Then 1 is to 5000 population should be 12th pass. Village health guide should be 6th pass. What is the population? Again, 1 is to 1001. Anganwadi, just remember, it is 1 is to 400 to 800. Okay, 400 to 800. So now look at this question. Now tell me what is the answer, and there should be no confusion regarding this. There should be no confusion regarding this. We are in Delhi. Okay, what do you expect? आपने एयर क्वालिटी देखी है दिल्ली की? तो सबसे पहले कौन मरने वाला है? ओके और मतलब सोचो, आप आशा खत्म हो गई, हम क्या करें फिर? Yeah, very good. This is your accredited social health activist. Okay, so you can see age group, 8th pass, married, divorce, belong to the same community. If any, all the other criteria is matching, you can decrease it to 8th pass. Okay, now look at the next question. Again, very important question, very one question short from this topic. A 30-year-old village in West Bengal, chief complaint of diarrhea. On examination, it is noted that the person has ascites and edematous extremities. On taking, they were found to consume mustard seeds. So what is the answer? Very good. It is epidemic dropsy. So we should remember what kind of questions come. So can you remember this image? This image is related to that. And this image was very famous. It was asked in the exam also once. Can you see what happened to the extremities? Can you appreciate the edematous extremities? Okay, can you appreciate? You can appreciate, I think. Yeah, very good. It is epidemic dropsy. So what I want you to remember, Latharism, it is boa, and it is mixed with kesari dal. Then you have your epidemic dropsy, which is, what is the toxin? Toxin is sanguinolene, right? And it is mixed, it is in argemon seeds. What about endemic ascites? What is the toxin? It is pyrrolizidine alkaloids. And ergotism, it is ergot toxins in grains. Can you tell me one medicine that we use in migraine that we don't use anymore, but it was there before for migraine? Can you tell me the medicine that we used in migraine? Do you remember dihydroergotamine? Do you remember this medicine? It was used in migraine, right? So what do they cause? Ergotism or anybody who uses this medication, they have a very high chance of gangrene. Okay, so the image of gangrene can come for this question. The image of gangrene can come for this question. Okay, so remember this: ergotism, dihydroergotamine. And what was the treatment, if you remember? Treatment, can you tell me for this? Can you tell me the treatment? What was the treatment for this? Treatment क्या था? If you remember, the treatment was sodium nitroprusside. Okay, sodium nitroprusside. So the image of that you remember. Okay, very, very important for your exam. So I related pharma with this, but it is important. And medicine, this is a part of medicine. Now we use, what is the drug of choice for migraine? You have your sumatriptans, right? Your triptans are the drug of choice, right? But this was used before. What happened was the patient got gangrene, and that's why they discontinued it, right? Very good. Now tell me this again, very, very. What am I doing you? Sure questions, I'm doing it for you. So you know this question is 100% sure. Every time one question from this has come, right? You know it, I know it. Yes. So yes, where does your blood bag go? It is yellow. What about your urine bag? Urine bag in red. Urine bag in red, blood bag in yellow. Okay, so how do we remember? Yellow, your biomedical waste management, yellow. Then you have which one? You have white, you have blue, and you have red. So what goes in your blue? If I talk about a syringe, where will the syringe go? Can you tell me? Where will the syringe go? Actually, you should ask me another question. Which part of syringe are you talking about, ma'am? Okay, so which part of syringe am I talking? The needle asking that is in white because all your sharps go in white. And if you know, recyclable waste goes in red, right? What about your blue? Your glassware as well as what? Dental implants, any implants, metal implants, all right, metal implants. Okay, they are in blue. And what about yellow? Yellow is all soiled waste, all soiled waste, all waste related to anatomical waste. Very good. So, and another question they ask is about when does it, like, how do you, yellow is done by what? So, it is done by incineration. How do you dispose that? Okay. So, this came in your June exam. And yes, it is your nonoxynolone 9. Okay, nonoxynolone 9. What about this one? What is given at birth? Okay, Bob is given at birth. Bob, pacemaker, see again, pacemaker is metallic. So where will it go? In blue. Okay, it will go in blue. Nonoxylon 9. What about this? Yes, B, birth and Bob. BCG, OPV, Hep B. All right. And you remember your live vaccines? Again, revise the live vaccines with me. It was MMR, yellow fever, BCG, OPV, then finally JE, rotavirus, varicella. And live vaccines done. Okay. Okay. Very good. Now look at this. This is a very easy question and repeated so many times. I can't even tell you the amount of times this has been asked. So please look at this. Look at this and let's answer this. Yeah, very good. So what is the answer? Yeah. What do you see? The 4 Ds. Remember the 4 Ds. What were the 4 Ds? So the 4 Ds was, and there was a question in your mock exam also related to this. So you need to remember your 4 Ds. Diarrhea, dementia. What else? diarrhea, dementia, dermatitis in the form of Casal's necklace. And finally, if not treated, the person will undergo death. Okay, so this is nothing but your Casal's necklace. It is showing you the dermatitis, right? It is showing you the dermatitis. Okay, and what about riboflavin? Do you remember? Do you remember about riboflavin? You will have, it is vitamin B2. So what will you have? You will have angular chelosis or stomatitis, right? Very good, very good. What about your vitamin B12? What about vitamin B12? You remember it is megaloblastic anemia, right? So both of them, I'm expecting if you can score 200 marks in NLC exam, you will score, you will pass, okay? And passing is more important than any other thing, right? So these two, both of them cause megaloblastic anemia. And what do you do? Megaloblastic anemia, how do you differentiate with B12 and folate? Can you tell me? How do you differentiate? How do you differentiate? Yeah, beefy tongue also. Beefy tongue also. Now tell me, how will you differentiate? Yes, folate will have no neurological symptoms. No neurological symptoms. While your with vitamin B12, you will have neurological symptoms. Why? Vitamin B12 is involved in making myelin. And if it is not there, then you will have neurological symptoms, as simple as that. Okay? Now look at the next question. If you want to explain nutritive value of various food items to a patient with the help of a chart, which of the following charts will you use? So when you talk about nutritive values, okay, when you talk about nutritive values, you know we are talking about percentage. Okay, we are talking about this much percentage of carbohydrates you should have, this much percentage of proteins you should have, this much percentage of this thing you should have. So whenever nutrition is involved or a percentage is involved, we always talk about a very good. It is a pie chart. So let's do the rest of the images also. See, this you remember, what is this? We saw frequency polygon. This is frequency curve. What is a frequency curve? Remember, frequency curve will have a histogram. Histogram at the back. Okay. So you can see there is a histogram at the back. And can you appreciate that the middle parts of the histogram are made into a curve, right? So remember, frequency curve has a histogram. What is a frequency polygon? You remember it was just a polygon. What about your ogive? Ogive was the one where we had frequency going on the top, right? So this is your frequency curve. This is your ogive where frequency will always go up. This is your histogram. This is your line chart where the frequency is going up and down. This is your scatter plot. What is this one? Anybody, can you tell me what is this one? Can you tell me what is this one? What is this one now? Very good. This is your box and these are your whiskers. You remember your cat that we drew? It was like this something and then we had whiskers on the side. ठीक है, बहुत बुरी cat है, बोलना मत, मेरी drawing अच्छी नहीं है, but I teach well. So this is the cat and these are its whiskers. Okay, so it's box and whiskers. Whisker. Okay, box and whisker. Okay, again it is used for quantitative data. What about this one? Can you tell me what is this? Can you see circles overlapping each other? Okay, circles overlapping each other. Can you appreciate the circles overlapping each other? Can you appreciate them? So what are this? This is nothing but a Venn diagram. Yes, where overlapping is present. Okay, can you see this is the part which is overlapped? This part, this part, this part. Circles overlapping each other. So Venn chart overlapping quantitative data. What about this one? This is your, see, we should never go wrong with such images. Images you cannot guess. You should know. What you can guess, options you can guess. But images you should know. So these are need to know things, and good we have enough time to learn all the images, right? And my promise, I will make sure we are done with images. Okay, so now look at this. This is gap is there, so this is your bar diagram. Very good. This is your bar diagram. What about this one? This, can you see? Whenever I see this, I remember the image of, I went to a park, okay? And in the park, there were seats, okay? There was a seat here, there was a seat here, there was a seat here. So I was seeing a couple here, then I saw another couple here, then I saw another couple here. So I always remember multiple couples, okay? And that's why I never forget that this is a multiple bar diagram. Okay, this is a multiple bar diagram. Just imagine a park with couple. आपका तो नहीं होना, ठीक है? तो आप किसी और को imagine करके खुश हो जाओ. All right. So this is a multiple. Yeah. I always imagine this multiple. I saw it in Calicut actually. So yes. So multiple bar diagram. All right. Multiple bar diagram. Always think of couple sitting, then gap, then, and this one is your component bar diagram. Okay, एक में ही इतना सारा component. So don't forget the name now. Multiple couples, multiple bar diagram, and component bar diagram. Now what is this? What is this? What is this? Can you tell me what is this? आश्रम, कैसी तुम्हारा नाम इतना प्यारा है और तुम ऐसी बेहुदा बातें कर रहे हो. Okay, tell. Very good. This is a pictogram. So any representation which can be read by a uneducated person also. कोई भी कुछ भी जो uneducated भी पढ़ सके उसको बोलते हैं pictogram. Okay, I can look at it and tell, अच्छा, this is exclamation, this is stop. So any picture which an uneducated person can read, that is a pictogram. Now wherever percentage is there, that is a pie chart. Okay, wherever percentage is there, that is a pie chart. Okay, Ashram, I'm just kidding. Chill out. ठीक है, बापू लिखा था तुम्हारे नाम पे इसलिए बोल दिया. All right, Ashram, chill out. What is this? Now, whenever we want to do geographical representation, okay, geographical representation, मतलब आपने किया कॉलेज में where you put up a map. And then you said, हाँ, this country I want to go, पर मेरा exam नहीं जाने देगा मुझे. So that is your spot map. Okay, this is your spot map. This is your spot map. All right. And then again, once again, spot map, pictogram, pie chart. This is your component bar diagram. This is your multiple bar diagram, Then wind chart, box and whiskers, scatter plot, frequency going up and down. This is your line diagram, histogram. Then ogive is where frequency goes only up. Okay, and then you have a histogram behind it and a curve joining it. So that is a frequency curve. Then polygon मैंने आपको दिखा दिया था. Okay, so we have some more questions to do. Let's finish it off. Look at this. We know that the answer now. This is a pie chart. Okay, this is a pie chart. फिर बाकी के कर लेते हैं. Now look at this. Tell me the answer. जो भी हो, let's clear the exam. Okay, अपन एक दूसरे की उड़ाते रहते हैं. Let's have fun with each other. कि मेरा कटा है, तेरा कटा है, and all that. But let's stay united. Okay, let's stay united. They cannot stop you or me. Okay, let's make sure of that. Nobody can destroy us. Let's not get destroyed. Let's pass this exam. Let's get out of this. All right, तो चलो. Okay, what is the answer? Very good. See, how can we rule out? Look at these two options. What are they used in? They are used in abortion. Okay, so you can rule this out right away, right? Both of them are used in abortion. So that questions have also been asked. And for emergency contraception, we give LNG 1.5. Okay, now look at this. A history of working in a place with groundnuts. Again, we did this question Remember, boa was for laterism. Boa was there. Groundnuts was associated with aflatoxicosis. Very good, very good. I'm so very good, Salik. Finally, you're saying hope. Okay. Yes, let's get out of the daldal. Very good, very good. Yeah. So this is your aflatoxic. Groundnuts, aflatoxicosis. Another, can you tell me more occupational diseases? Let's revise. Occupational. You remember silicosis? Silicosis, can you tell me one disease associated with silicosis? People who get silicosis, they are very, very good. That is TB. What about hepatosis? What about your asbestosis? What is the most specific cancer related to asbestos? What? Very good. It is mesothelioma. Okay, mesothelioma. What about cotton? Cotton, it is bisonosis, right? Bisonosis. What about with your sugarcane? Sugarcane, it is vagasosis. तो इससे तो एक क्वेश्चन आना ही है. You can see 1 year they have asked about aflatoxicosis, the other time they have asked about this. So one question is sure from this, right? All right. Yeah, very good, very good. Now look at this. Most common cause of childhood. If here they would have put adult, what is the answer? I want to know adult. Okay? Adult, tell me. Nahi, Avantika, I will not give the PDF. Yes, it is lung carcinoma. Which kind of lung cancer? Umar Khadir? Umar? आप मेरे भाई हो? Your name is Umar Khadir. I am Sara Khadir. अगर भाई नहीं हो तो शादी कर लो. नाम ही नहीं चेंज होगा. Yeah, adult is cataract. Very good. For adult, it is cataract. For children, it is vitamin A. And another thing I will ask you, what is the most common cause of visual impairment? That is another question that comes. These are all one-liners. तो visual impairment का बता दो. Tell me about visual impairment. Visual impairment. What is the... Yes, very good. Most common cause of visual impairment is refractive error. And you should remember, Bitot spot is seen in which type of... Which stage? Can you tell me Bitot spot, which stage? It is... Bitot spot is seen in which stage? X1b. Very good, very good. So this is your Bitot spot. Can you see the base of the triangle? It is triangular and the base of the triangle is near the iris, right? And I've written down everything here. This is the first symptom that you can see, conjunctival xerosis, okay? And X1b is your Bitot spot. So I've written it down. You can go through this. And refractive error is the most common cause of visual impairment. Trachoma, what is the management? It is safe strategy, right? Safe strategy. So Ashram, मैंने क्या किया है? What I've done is I've combined NEET PG and FMG PYQs so that you know this session is useful. क्योंकि FMG तो you know already. What is the point of me telling you FMG again? So I've combined NEET also. So this PDF includes both. All right. Very good, very good. So this is your safe strategy. Now look at this. What is the percentage of 1 SD in the given graph? So firstly, you should know what is the meaning of standard deviation. So what is standard deviation? Standard deviation is very simple. It is the deviation that is, if your mean or your average, the deviation away from the average. So this is your mean. Can you see? And can you see this is one standard deviation? It is how much you're deviating from the average, right? So this is your mean, the middle line. Okay. So let's do this. What is the name of this curve? What is the name of this curve? Okay. What is the name of this curve? First you tell me that. First you tell me that. What is the name of the curve? What is the name of the curve? This is known as bell curve और देखो कुछ संपत, some questions are from the PYQ book, some questions are from NEET. So it is a combined, okay, Bell's or also the other name Gaussian curve. Okay, even that has been asked in the exam. So we need to remember the deviations as well as the so ma'am has done it. Look at this. So when we talk about one standard deviation, this is the mean. So this is your one standard deviation, and how much population will it include? 60. Can you complete it for me? Yeah, and this is known as the Gaussian distribution or your bell curve. It is known as your Gaussian distribution, right? Gaussian distribution. So always remember here mean is equal to median is equal to mode. All right? तो अब इसको देखो. Okay, is your 60. First standard deviation 68. Very good. Now second standard deviation will include the population. How much population? 95% of the population. And third will include 99% of the population. Okay. So this is 3 minus 3 SD plus 3 SD. And this we do in your, what do you call it? For your severe acute malnutrition. Can you tell me what is the criteria for severe acute malnutrition? And we are talking again about standard deviation, right? So tell me, what is the criteria of severe? Let's go to pedia. Let's remember that also with this. My live chat, is it lagging? Am I going too slow? Yes, it is. Yeah, it was your MAC, mid-arm circumference should be less than 11.5. You remember this? There should be bilateral pitting edema. And your SD, how much should be your SD? Yes, it should be less than 2 SD, right? So this was your severe acute malnutrition. So very, very important. If you can connect, if you can integrate different subjects, you will see, did I read somewhere? No. I remember it because I've always integrated subjects. So if you also do it, and you have enough time for that now, we have enough time for integration. Okay, so let's do it. Okay, and what is this? What is this? Can you see it is your, this is your Gaussian curve. Now, if it is negatively skewed, it looks like this. So this is your negative skew, and this is your positive skew. Okay, so always remember negative is left, left is less. So mean is less than mode is less than median. Okay, mean is less than median is less than mode. All right, so your negative or left is mean is less than median is less than mode. All right, while your positive, again positive अच्छा है तो बढ़ जाएगा, तो mean is more than median is more than mode. All right, so remember left, right याद आ जाएगा. Got it? Okay, let's go to the next question. Let's go to the next question. Let's finish it fast. What is 1SD? We remember it now very well. It is 68%. Okay, 68%. According to MTBC, same question पूछे हैं. Right? Every session, these questions have been repeated. So I don't want you to lose the marks where questions have been repeated. So I did it topic wise. Did you notice that? Did you all notice? I did it topic wise. So again, remember your TFR, it was average. NRR, mortality was considered. GFR was general fertility rate. GRR was where mortality was not taken. Like that, you revise again. Okay, very good. MTP can be performed till 24 weeks. Okay, with the new guideline, MTP can be performed with 24 weeks. Okay, 24 weeks. MTP हमेशा पूछते हैं. And what are the drugs for medical abortion? Let's revise those also. Medical abortions, you have 2 drugs. Which 2 drugs? Let's revise that. It is misoprostol and mifepristone. So you remember this क्योंकि ये ना as a doctor also it will help you. Has this not happened to you where suddenly you got a call and he was like, hey, you're a doctor, right? Can you tell me my girlfriend became pregnant, can you help me? So I'll teach you this and you remember it for your friends also. So misoprostol, remember, we usually by how much time can you take 400? Till what time can you take 400? I'll tell you the doses. Mifeprostone is 200. Misoprostol, actually it comes in a kit. I'll tell you, this kit is named as unwanted kit, here in Delhi at least. Okay, and there you have one drug on the top, and then you have 4 drugs in the bottom. These four, okay, these four, they are combined. These four, I'll just cut it off. These 4 drugs which are on the bottom are your misoprostol. Okay, I'll just write it down here so you remember it. Okay, these are the 4 drugs which are your misoprostol, and this one drug is mifeprostone. Okay, so mifeprostone you need to give only once, and you give it, yes. So around 7 weeks, around 7 to 8 weeks also you can consider. 7 weeks you give only two tablets, 2 tablets, which is equal to 400. After 7 weeks you give 4 tablets, okay, which is equivalent to 800. Samjhe? Did you understand? Okay, pani. All right, so you take mifeprostone 48 hours before, you take it orally, and these 4 go vaginally. All right, I'll tell you once again because today picture also I drew it last time and it came in the exam. So we never know, this can also come. So remember, garam chahiye tha, but it's okay. Agar Vicks hai to de dena. Again, I'll draw it for you. So this is your kit. Okay, this is your kit. On the top you have 1 medication, and on the bottom you have 4 medications. So this 4 medications, which is red, okay, this is your misoprostol. Each tablet is for 200, while your this one, the blue one is your mifeprostone. Okay, so this is also 200, this per tab. Okay, this is also 200 per tab. So before 7 weeks, by 7 weeks, you can just give 2 tablets of misoprostol. And how do you do it? First tablet is mif. I'm sorry, I have a cough which is not going. And do I have TB? That's what I asked, but I've taken my vaccine. I don't know what's wrong with the cough. Maybe because I live in Delhi. Okay, yeah. So the first medication that you take is mifepristone, and then after 48 hours you take miso. So if it is by 7 weeks, you take only 2 tablets, which is equal to 400. If it is more than 7 weeks, you take 4 tabs, which is 800 mcg. So remember this, very, very important. And they have even asked this in exams so many times. What kit is this? This is known as unwanted kit. Okay, unwanted kit. All right. So will you remember this? Will you remember this? Got it? Got it? Okay, let's go to the next. Look at this. Again, one question from this topic. Not one, maybe 2 or 3, because this is biostats, it will come. Okay? Actually, as a doctor, you should know. All right? Salik. Okay. So what is the answer? So when we talk about cohort and when we talk about case control, and you have your ecological as well as your, which other study do you have? Cross-sectional. Okay? So you should remember some things which can help you solve any question. Firstly, cohort. What can be found in cohort? Remember, cohort is a forward study. So if I do it today, I'll get the result after 15 years. So it is a forward study. It is a prospective study. Okay. Forward study, prospective. What can you find since it is a forward study? Because you're doing it in lifetime, you can find the incidence. You can find the relative risk. What else can you find? Attributable risk or population attributable risk. You can find all this. In case control, it is again a retrospective study. Retrospective. So you're going backward. You're just taking the history of the patient. Okay. Retrospective. Then what else? Very good, very good. Nutritional is ecological. Very good. Retrospective, it is backward. And what can you find? What can you find? Yes, so odds ratio. So with this itself, you can solve so many questions. Ecological, it is also known as ecological, or your cross-sectional. It is also known as pen color. I should change. Okay, I'll change the pen color. I'll make it black. Okay. Ecological, the unit of ecological study is population. That is the main thing to remember. For everyone else, it is individual, it is individual, it is individual. Okay, but for ecological study, it is the unit of study is population. All right, so this is also individual, which is known as a snapshot study. And remember, both of these are done at a point of time. Like it is done right away, okay, at a point of time. Snapshot study, very good. It is your cross-sectional. Okay, very good, very good. So now look at this. Do I need to read the whole question? For the incidence of deafness, incidence is found in cohort. That's it. The answer is right there, right? Cohort. All right, now look at the next question. If you want to reduce selection bias in a clinical trial conducted among two groups, best method will be. What will be the best method? What will be the best method? फिर से yes, exam has been postponed. Please go to your respective groups. First open that group and check. पूरा बखेड़ा हो चुका होगा group में. All right? Yes, randomization is the best method. If they ask you for confounding bias, which is the best method? If they asked you for confounding is matching. Okay, confounding, matching. All right. Thank you so much. Thank you so much. Okay. Confounding is matching. For randomization is the best method overall. Okay. Now look at the next question. Okay. Now look at the next question. A couple has given birth to their first child. The family is entering. So couple are two people. Now they have one more in between them. So this is addition. So addition is nothing but expansion, right? So what happens first? The couple actually get married. That is known as formation. Then they have a child. That is known as expansion or expansion or extension. The third thing is that child leaves the family. So that is contraction. And when all of them die, that is dissolution. Okay. So it's given in a nice format. All right. Now look at the next question. Pregnancy kit for the follow-up. So I remember it very nicely in Hindi, but I do not want to say you that. Okay. I know it very well. I don't get confused in this question because I know it very well. परिवार लंबा कर देना इसलिए तो अजय. Very good. It is Nischay. So can you see Che? Che is okay. Nick Share is the app for TB. For TB. Okay? And your निश्चय has चे in it. चे से चो, तो चो से बच्चा. So you remember it, don't. Okay? Okay, don't forget it. I remember it like that. Okay, okay. चे से चो से बच्चा. So that's how you remember it. All right. So this is your today. Today means on, right? So don't forget it. Don't forget it. Now look at this. Look at this question. अरे भवेश, आप बहुत प्यारे बच्चे हो. मैं तो I see, make it dirty, you will remember it better. ओके. जिसकी डैश खड़ी है वो क्या है? जिस एस, वो क्या है? द एस इज अप. सो या, द एस इज अप. This because very good, very good. 45-degree angle. I remember the S. Okay, the S is up, so it is malaria. Very good, malaria. What about dengue and chikungunya? That is caused by Aedes, right? And your Japanese encephalitis is caused by Culex. Okay, Aedes. What does Aedes look like? Aedes look like. Aedes look like. Aedes looks like a tiger, right? It has tiger wings. It 100 meters. Remember the 100 meters, the tiger wings. Yeah, very good, very good. Now look at this question. Look at this question. Look at this question. Okay, an A&M receives 2 open vials, an MR vaccine and a pentavalent vial. Which of the following can be used? So for this you have to remember which it is not applicable for. And you remember your live vaccines. Tell me, what are your live vaccines? Again, go back to the basics. MMR, yellow fever, BCG, OPV. Then you have your JE, rotavirus, varicella. If you remember your live vaccines, what is it not applicable to? Can you tell me? BCG, MR, JE, rota. Are they nothing but your live vaccines? So it is not applicable for the 4 live vaccines that you can see. Can you, if you remember your live vaccines like that, can you not take them out and remember what it is not applicable for? And what is your open vial policy? You remember the vial, आपको vaccine लगी है. That vial, it is supposed to be discarded that day itself. That vial should be thrown that day itself. But what happens? For some like open vial policy is applicable where you can keep that vial for 28 days. Okay, for 28 days you can keep it open. So for which ones can you keep it open? DPT, TT, Hep B, OPV, pentavalent, PCV. But this is hard to remember. So just remember what it is not applicable for. Okay, what is it not applicable for? Your live vaccines. Which ones? BCG, MR, JE, rotavirus. Okay, BCG, measles, or MR, JE, rotavirus. All right, and if possible, now you have enough time. आपकी तो लग गई है, ले ली है. So now you remember what it is applicable for. Okay. So tetanus, तो your toxoids you already know. Your toxoids you know. So it is applicable for your toxoids. Think of it like that. Okay. It is applicable for these 2 and these 3. Okay. So find a way to remember. So which one can you discard? You discard MR and you use pentavalent. All right. Again, open vial policy is where you can keep the vial for how many days? 28 days you can keep the vial open. Okay. Open vial for 28 days. For which ones it is not applicable? BCG, MR, rotavirus, J. Okay. Which are nothing but your live vaccines. Okay. Now look at this. Easy question. All right. Again, easy question. Tell me the answer. We will not waste much time with it. Very good. So which one is done by incineration? That is nothing but your yellow. Okay, and revise which one goes where, which one goes where. Now look at this. Ortholudin test is used for measuring which of the following. So this is actually used for chlorine, and there are only two tests. One is your OT test, one is your OTA test. OTA, with OTA, can you remember that image that there is a hyperpigmentation on the face? Nevus of OTA, which nerve does that involve? So with every word, can you integrate it with another subject? Tell me, nevus of OTA, which one will it involve? OTA is on your face, so that will involve the trigeminal nerve. Okay, the trigeminal nerve, right, on the face. You remember it comes in derma. This question comes in derma. I just want you to remember one thing in this question. Fifth, the branch of fifth nerve, right? So remember the fifth nerve, right? Okay. Okay, with everything you can, what do you say? So the answer for this is very good. It is, what is it? Very good. Everybody has given me the right answer. Yes, it is free chlorine and combined chlorine. So just remember, which is the better test? It is OTA, which is your ortholudin arsenine test, right? What does it tell you? It tells you free chlorine levels. It tells you free and combined chlorine levels. It cannot tell you free and combined chlorine levels separately, which is done by OTA, that's why it's a better test. So they can ask you only two questions. Which ortholudin test is used for measuring what? You already know it is free and combined chlorine. Okay, it tells you together, it is known as OTA. If they tell you free and combined chlorine separately, free and combined chlorine separately, that is OTA. If they tell you free and combined chlorine only, that is ortholudin test. That's it. That's it. Okay, no confusion here. If they tell you free and combined chlorine, that is OT test. If they tell you free and combined chlorine separately, which I've written it down, that is your OTA test, which is a better test. That's it. No more confusion in this. All right? No more confusion in this. Can you remember this? Can you remember this for me? Can you remember this for me? Very good. बीच बीच में ये कौन आ जा रहा है एग्जाम पोस्टपोन हो गया जैसे कि हमें नहीं पता. Yes, now look at this. Health checkup in a village school is the responsibility of which of the following centers? So again, it is easy. Anywhere health checkup is done, it is the responsibility of only one thing, it is PHC. Okay, and we'll do more questions related to this. Which is the first referral unit of India? So you have to know what is the first level of contact. First, tell me this. What is the first level of contact? Tell me this first, answer this. I want an answer for this. What is the first level of contact? Very good. First level of contact, if they ask you that is PHC. From PHC, where do you refer first? Where is the first reference to? It is CHC and sub-district hospitals. Then what is the second referral unit? Okay. So primary or the first level of contact is PHC and sub-center. What is the secondary? Secondary, CHC or sub-district hospitals. Sub-district hospitals. What is the second level of contact? Medical colleges or district hospitals. Okay, district hospitals. So what is the first level of contact? PHC. If they ask you first referral unit, from there you will send to where? So that would be your CHC as well as sub-district hospitals. What is the second level of contact? Colleges and medical colleges and district hospitals. Okay, so remember it like that. I've written down the explanation. Please go through this. No time to waste on this. RT-PCR, China है RT-PCR. Okay. PHC, you choose Himanshu, you choose PHC. Okay. PHC is where most of the people go to. All right. If they ask you first level of contact, choose PHC. Okay? So no discussion on this. Now look at this important question. Very, very important question. One question on dehydration is 100% sure. It involves pedia as well as your PSM, right? Now tell me the answer for this. So for this, we have to know the diagnosis. What is the diagnosis? What is the diagnosis? Tell me, what is the diagnosis? Diagnosis is some dehydration, right? Some dehydration. So actually this topic is very close to me because my dad was admitted in a hospital on December 2021 because of dehydration, and I always remember this topic because of that. तो मैं आपको नहीं बताऊंगी, पर remember this. How do you remember? We'll make a table, okay? So if there is no dehydration, or mild, you can call it mild dehydration, what will be the symptoms? The child will be active and alert. But how do you know this child has dehydration? Because this person will have diarrhea. Okay, diarrhea is there, but this child is dehydrated and alert. All right. Ha, Hema, you remember? Yeah. So very good. And what do you give? ORS for this child. What about some dehydration? Again, for some dehydration, remember, how will be the child? How will be the child? He will be irritable. बहुत गंदा बच्चा है ये. Irritable. He will be crying. Okay, irritable, thirsty, very thirsty to drink water. Thirsty, irritable. There will be what else? What else in this? What else in this? So the child will be irritable, thirsty, and this child will be able to drink water. Okay, will be able to drink water. Water. So what will you give to this patient? You will give ORS. How much ORS? That has been asked in NEET PG. So 75 ml over 4 hours. Okay. Then finally you have your severe dehydration. How will be the eyeballs here? They will be very sunken. And you see sunken eyeballs in some dehydration also. But they will be very sunken in severe dehydration. Okay. So it's severe dehydration. How will it be? Very good. Very good. So this will be your skin pinch test will be more than 2 seconds. Pinch test. Okay, I just wrote SPT. And the CRT will be slow. Your capillary refill time will be slow. Okay, CRT is slow and very sunken eyes. Also, what else? What else? This child, will he drink water? No. Will be very lethargic and will not drink water. And what will you give to this child? What will you give to this child? Yes. So what will you give to this child? Which IV fluids? Yes, IV fluids will be given. And IV fluids like ringalactate more than NS. Okay, more than NS. You remember this much? All right. And then you divide them into less than 1 year, more than 1 year. Okay, that is pedia. So here the answer is, this child has 14 episodes of diarrhea, but he is eager to drink. So this is ORS. Some dehydration, ORS. All right. What about this one? You need to spend time on this. Again, easy. Easy, right? It is component diet. Component. Can you faster now? You people are very till the end. For 2 hours you've sat, even though you know that news and that, but you stuck. Where did I write MG? I wrote ML. I wrote ML. Okay. Very good. Very good. Now look at this. This I have to do together. Thank you. Thank you. A table. Can you have a pen with you? And can we make a table together? Because any question can be asked. this is an important question. Blindness पे एक question पक्का है. All right. So tell me. Let's make a table together. Firstly, what do I want you to remember? What is low vision? What is low vision? What is low vision? Can you define low vision for me? What is low vision? Low vision is 6 by 6 less than 6 by 18 to 6 by 60, right? And you 6 by 60. And you, what the only thing you have to do is just put lesma. एक लड़की है, there's a girl called Lesma and we will leave her after the exam, okay? Exam तक उसको साथ रखना है. तो Lesma is low vision and then you have economic, right? Then you have social blindness, you have manifest blindness, you have absolute blindness. And what do you need to do? Just put this, okay? Just put this here, all right? So now what will it be? Less than 6 by 3 by 6, okay? And 6 by 60 to 3 by 60. Again, put this down, all right? Less than 3 to 1 by 60. Bring this down here. Less than what is manifest? Less than 1 by 60 to perception of light. And absolute is no perception of light. Okay? Can we... Is there a lag? Is there a lag, guys? Can you do it? Can you make it in your exam, in your mind? See, I remember it very well because in my mind, I can make it. पास बुलाना है. Mudit, I read पास बुलाना है फिर हाथ हिलाना है. So I was like, what are you writing? Thank you, Faizan. Thank you, Faizan. All right. Yeah. Is there a lag? Is there a lag? Okay. Voice is breaking? Is the voice breaking? All right, all right. Voice break हो रही है क्या मेरी? एक बार check कर लेना. Okay? Mudit, इसीलिए तो. Now look at this question. Okay. All right, guys, am I audible? Okay. Am I audible? Yeah, okay, very good. Acha. No voice? Yes, no voice bola. Can you just check over there if my voice is audible? So guys, make this table for your exam. एक लड़की को नहीं छोड़ना है. कौन सी लड़की? लेस्मा. Okay? Don't leave लेस्मा. लेस्मा को exam के बाद छोड़ना है. And there was this thing ना, लीना को नहीं लेना. लीना को नहीं लेना. Which topic am I talking about? Can you tell me which topic I am talking about? लीना को नहीं लेना. Which topic am I talking about? Yeah, Lena Gliptin, right? Lena, you do not measure the renal. Except Lena, everyone else you measure, right? We are talking about DPP4, right? So, except Lena, yeah, everybody else can. So, Lena ko nahi lena. Sita Wilda, yeah, I remember it like that, na? Haan. Okay, okay. What is this? What is answer? Yes. There are 4 pillars of your PHCs and family mobilization is not that. It is safe in renal failure, right? It is safe. Lena is safe. तो लीना का we should not check the dose. That's how I remember. लीना, you never check the dose because it is safe in renal failure. So लीना को नहीं लेना. That's how I remember. Okay? Okay, you got it. How I remember. All right. So yeah, what are the four pillars? Lina is safe in renal failure, तो उसका we will not check the renal. For every other drug we will check renal, but for Lina we don't have to check. तो Lina का नहीं लेना. That's how I remembered. Okay, no confusion in that. आपको जिसको लेना है ले लो आप. All right, I remember Lina को नहीं लेना. All right. So what are the four pillars of your PHC? What are the four pillars? Yes, the four pillars or four principles are equitable distribution among the community, community participation from all the sides, and appropriate technology, again, for the community to be together or make progress. There should be appropriate technology, and finally, intersectorial coordination, right? Which one was not given here? It was your equitable distribution. All right. Now look at this. This is another question जो आता है exam में. This question comes. Thank you, thank you, thank you, thank you. ठीक है? Now tell me. Okay, okay. Now let's do this. ठीक है? तो we are talking about again surveillance. With surveillance, what image I want you to remember? What image I want you to remember with surveillance? Can you look at this? What is this? Tell me what is this? तो सबका जुगाड़ करके बैठी है मैम आपकी. Now look at this. Look at this. What is this? This is your. What is this? This is your integrated disease surveillance program, right? Integrated disease surveillance program. So even this image can come for the exam, right? So we should know the image related to what we are learning about. Okay, so what are we learning about? We are learning about surveillance. Okay, with surveillance, it is active when you come to me. I am the doctor. If you come to me, that is active. Which is the most common? Which is the most common? Is it active? Is it passive? Or is it sentinel? What do you mean by sentinel? चलो साथ में solve करते हैं. Active is when you as a doctor, like आप सब doctors हो, मैं भी doctor हूँ. When you go to the community, that is active. Which one is the most common? Yes, most common is passive. अपन कभी गए हैं community? नहीं, हम बैठते clinic में, सब आते clinic. तो that is the most common. The patient comes to the doctor. The doctor, and can you tell me active surveillance for malaria is done by what? That's another question. That's another question. Okay, active surveillance for malaria, it is done by? It is done by? Yes, MPW male. Okay, male malaria. All right, MPW male. So this is active surveillance. Passive is when the patient comes to you. Which is the most common? You have seen everywhere patients come to you. We don't go. हम special है. हम नहीं जाते. And sentinel is hidden cases. Hidden cases. Can you give me an example of that? That is HIV. Hidden HIV. H for H. Okay? Ma'am, is she doc or Asha? Yes, very good. Export in. Okay. So I've written it down here. For what cases do we go? For what cases do we go? That is also very important. In the community, we go to search for cases for malaria, MPW, polio, TB, and Kala Azar. Okay? Malaria, polio, TB, and Kala Azar. All right? Okay? Let's go to the next question. Most common head and neck cancer. Let's just remember it. You have seen it. Either it is this or it is. Okay, so both of that is oral cancer. All right, both of that is oral cancer. Okay, you know that, right? Now look at this. Okay, look at this question. So this is also a very, very easy question. So any study that we do, ऐसे मत बोलना, कोई एक्सपीरियंस नहीं है, तुम्हें लगता है मैं गुटखा खाऊंगी, कुछ बोल रहे हो तुम, छी यार. Yes, yes, yes. Anjana, I will share the PDF. Now, what I want you to remember, in any case, we take exposed versus non-exposed, or we take, or what do we take? This is taken for what? Exposed versus non-exposed. What kind of study? What kind of study? What kind of study is this taken for? This is taken for RCT trials. What about your case control as well as cohort? We take cases and controls, or exposed versus non-exposed, anything. So one that has the disease, one which does not have. Okay, now look at this. We have to do ordering food, development of obesity. So in one patient that is obese, one that is not obese, that should be the population. Now in the options, which one? Only obese patients, how will you compare it? Then online food ordering population, how do you know whether it is obese or not obese? So it should be obese and non-obese. You are talking about obesity, right? So you will be taking people who are obese and non-obese. Got it? Got it? Got it? Everybody with me? ठीक है? चलो. Obese versus non-obese. Don't forget that. Then Opal Vial policy is not applicable for, see, again the same question was repeated. What is the answer? You know. What is it? We told toxoids can be given. Toxoids can be given. I told you. Then Hep B also can be given. It is applicable. Measles, no. Okay, measles, no. Right? Now look at this. Next question. Which of the following vaccines have a faster seroconversion? So with sero, what do you remember? Serum. What do you have in serum? You have antibodies. So basically in this question, they are asking you which vaccine has a faster antibody, where antibodies are made faster than its incubation period. That is only one vaccine. Which vaccine is that? That is measles. Okay, the conversion of antibodies coming is 7 days for measles, and you know the incubation period क्या है? 10-14. Okay, 10-14. What is the incubation period? 10-14. So 7 days is less compared to, so it is faster, right? Did you understand, guys? Did you understand? Okay, great. All right. And what about the other vaccines? Orchitis is a complication of, what is the most common complication? Tell me first, what is the most common complication of this disease? Okay, so yes, it is mumps. What is the most common complication? Can you tell me? What is the most common complication? Is it orchitis? Your mumps is actually which age group? 5 to 9. And what is the most common complication of the children that age? What is the most common complication? It is aseptic meningitis. Okay, it is aseptic meningitis. Remember this. If they ask you the most common complication overall also, because mumps actually is seen more commonly in 5 to 9 years population. So in children also most commonly aseptic meningitis. So overall, most common complication is aseptic meningitis. All right. So see, bull's neck is seen both in diphtheria and mumps. Remember, diphtheria, it is unilateral, but mumps is always bilateral. All right. Mumps is always bilateral. I'm ending the class. Okay. So I have written it down. Most common complication in mumps is aseptic meningitis. Most common complication in adolescents is orchitis or euphoritis. In adult, it is meningoencephalomyelitis, but adults, it is not very common. All right. Diphtheria also, we have swollen neck, right? We have swollen neck. Why am I messing it up? I should not end class. You don't want me to leave you? Okay, but So many people have left, right? Tell. I will come back. Okay, you जाऊंगी तो अभी वापस आऊंगी, वरना आज ही बस रह जाऊंगी. Yeah, very good. This is your Suraksha clinic. And with Suraksha clinic, you remember what you have to remember? This. Acha, this I already showed you how many workers? How many workers? How many workers? Can you tell me? Asha worker, rural areas. I have just showed you it is 1000. So see, there was a controversy on this. Don't get confused. It is 1000. Okay, as simple as that. What about this one? Read the question. Let's. Thank you, Sultan. Thank you so much. Himanshu, what faculty has taught you? You study that. I am tired of the controversy. For me, it is 1000. Okay? For me, it is 1000. You can choose 2000 if you want. All right? Some faculty is saying it is this, some faculty is saying that. आप हमारी मिलके लेते हो, तो I don't know what to do. I will choose 1000. Okay. Now look at this. What is this? All right. ठीक है. Now look at this. Tell me. Among two groups of study, divorced and non-divorced, history of alcohol was taken. Now, so history or retrospective or backward, which study is that? That is case control. Okay. So such big questions, what do you have to find out in such big questions? Find out what is the keyword. Here the keyword is history, right? So this is case control, backward. All right. Now look at this. STD kit for a female with vaginal discharge. We know it is, let's go through. Urethral discharge, you have gray kit. Then vaginal discharge, you have green kit. Then after that, you have, what do you have after that? Yeah, very good. So this is your green kit and you have to go through this table. Okay. So gray kit is for urethral discharge. Then genetic ulcer, which is non-herpetic, that is white. Herpetic, non-herpetic, but resistant to penicillin, that is blue. Genetic ulcer, now that is herpetic, is red. Lower abdominal pain or PID is yellow. And inguinal boo-boo is black. Boo-boo is black. Okay. So yeah, however you want to remember. I remember boo-boo is black. All right. So this again, the answer, you know, one question from this we can get. Suraksha. So this is gray. Urethral, male urethral discharge, right? Okay, now look at this. After which phase of clinical trial a new drug is introduced? Again, very, very important question, and you know this question has come, right? So many times it has been repeated. So let's remember, what do we have? What kind of, in phase 1, what do we have? Is it phase? Very good. I don't need to teach you only. तुम्हें तो सब पता है. Okay, so phase 1 is where you do the trial on what? Cases or healthy people? Yes, it is normal, healthy people. Except for, that is an exception you have to remember for in first, which except for? What do you, healthy but for anti-cancer. Anti-cancers we use, anti-cancer drug we use patients, okay? We don't use healthy people in anti-cancer, we use patients, all right? Then phase 2, because we start using more people, efficacy is started here. Efficacy is started here, but it is confirmed in phase 3. Confirmed in phase 3. And post-marketing surveillance is done in phase 4. So if they ask you after which it is brought into the market, so yes, it is after the 3rd phase. Okay. If they ask you in which, now what will be the answer? In which phase? So which one will you tell? In which phase is it brought into the market? In which phase is it brought into the market? If they sell you in which phase drug is brought into the market, that is phase 4. Okay, phase 4. Don't forget this, all right? So after which drug is brought into the market, phase 3. In which phase is brought, the drug is brought in the market, phase 4. Got it? Got it? Got it? Everybody with me? Yes. So the answer here is phase 3. Okay, the answer here is phase 3. Now look at this. An ER nurse was accidentally pricked. They want confirmatory diagnosis. So firstly, remove PCR and ELISA because they are used for screening test. We are talking about confirmatory diagnosis. Okay. And out of P24 antigen and Western blot assay, the best is Western blot assay. Okay. If they ask you earliest, it is P24. And yeah, if they ask you earliest, it is P24. Phase 0 is microdosing done in. Phase 0, tell me, it is microdosing. All right? Yes, very good. So the best is Western blot assay. All right? Then look at this. Again, important topic. Hepatitis is going to come in your exam. So tell me about this. Just 10 more minutes and we are done. Please don't leave me for 10 minutes. Okay? Let's do it together. ऐसे ऐसे अपने आप को ऐसे ऐसे हिलाओ और बैठ जाओ 10 मिनट के लिए. Okay? And let's do it. All right? ठीक है, चलो. What is the answer for this? So they are talking about hostel, boarding school, eating from the same canteen. So they are talking about the fecal-oral route. Okay? Just from the question you can get this. Hostel or the same canteen, they're talking about food. और food hostel में कैसा मिलता है? अपन FMG को पता है. Okay? Us FMG knows how food is in the hostel, right? So it is E or A. Okay? So what can we rule out right away? Let's rule out B. B is blood products. B is, so it is not. If they tell you pricking needle and all, that is B. So we don't need B. And which one? Which of the following will you establish? When a infection is new, it is acute. If they're talking about something that presented with similar symptoms, jaundice, abdominal pain, this happened right away. So it is acute. Acute, we have what do we have? We have antibodies against the core. And which one do we have? We have IgM, which comes in acute. And after 2 weeks, we have IgG. So which one will I choose the answer now? Yes, very good, very good. The answer is IgM for hepatitis A. Okay? IgM for hepatitis A. All right? I can explain this topic very broadly, but I'll do it in other PYQs. Like I can write down everything and I can make tables and you will all leave me. Okay, but it will take me 300, it will take me half an hour to do that. All right, so next time I'll explain hepatitis very well and we will make sure कि हम अच्छे से याद रखें. Okay, so acute में M आता है. ठीक है, acute में M, for chronic it is G. Chronic G, GC और acute में M. Thank you, thank you. Now look at this. A child has an IQ of 55. Hello? Hello? I'll come. Okay? Yeah. ठीक है, अब ये बता दो. Child is acute. अरे, you should never get wrong for this. You should never get wrong for this. All right? So how do you remember IQ? What is the normal IQ? First tell me normal. What is the normal IQ? चलो आज मैं आपको याद कराती हूँ. Okay? I will make you remember. Tell me what is the normal IQ? Normal IQ, बोलो. Normal IQ. It is, okay, it is 94 to 114. It is 90 to 114. Okay? Specific. 90 to 114. When do you call it intellectual disability? When it is less than 70. Okay, ये तो पता है आपको, it should be less than 70, right? So that is known as intellectual disability or mental retardation. What is the most common cause of intellectual disability? It is, what is the most common cause? Tell me that. What is the most common cause? It is Down syndrome. What is the second most common cause? What is the second most common cause? It is fragile X syndrome. ठीक है? Fragile X syndrome. So these are the things that should come into your mind right away. Then how do you remember what is mild RR? So it starts with 50, 50 to 69. And you remember 69? Never forget 69. ठीक है? 69. 50 to 69 is your mild RR. Mild. Then just go 15, 15 below. Right? So now look at this. 50 to 69 is mild, then go 15 below. So that is 35 to 49, 20 to 34, and profound is less than 20. Okay? Remember 69, sab yaad rahega. 50 to 69 is mild. So it is mild eye. Alright? Okay? Everybody with me? Tell me. Please give me a yes. Chalo, bas kuch aur questions. It's done. Prevalence is associated with prevalence. So again, we are talking about disease. So it should be sensitivity, specificity, positive predictive value, negative predictive value. Okay. So sensitivity means all positives. Everybody who is truly positive is your sensitivity. Specificity is truly negative. Okay. Positive predictive is all positive. So what is that one? Yes, very good. Faizan, very good. Yes, Ravina. It is positive predictive value. Okay, positive predictive value. What are the formulas? Remember the numerator. Truly positive sensitivity, truly negative specificity, and positive predictive, all positive values. Okay, so positive predictive actually tells you the prevalence. Okay, P for P, prevalence. Got it? So just remember, truly positive sensitivity, specificity is truly negative. Okay. Now look at this again. One more question, that is, you saw how many questions we did in 2.5 hours, and we covered such various topics. And you know this is coming. You know, right? This is coming. क्योंकि ये question आते हैं, यही question आते हैं. Okay. Now tell me. A man came for checkup after his father had cerebrovascular accident due to hypertension. So he is doing screening. That is in secondary. So what do we have in primordial? What do we have in primordial? What is the definition? Even risk factors have not occurred. Okay? Even risk factors have not occurred. Can you give me an example? So in 5th standard, you remember, I don't think it happens in India, but I remember it as sex education. Okay? So sex education, remember, that is primordial, because that sex education is supposed to happen when you are a kid, and usually we don't have sex. Abhi kab mujhe generation ka pata nahi chal, means I don't know that generation now, but at that time we did not have sex when we were small. Okay, so no risk factors are there, no risk factor also. What about primary? Primary is now divided into two. Okay, this is risk factor is present, risk is present, but no disease. Okay, no disease, right? So it is divided into what? It is divided into specific protection, and what? Specific protection and health promotion. Health promotion, right? So if you get the example of, can you give me an example of specific protection? Yes, condoms. Condoms are the biggest example of specific protection. You know, we wear it. I mean, I don't wear it, but basically the guys wear it to prevent against STDs. So it is specifically protecting you against STDs, right? So that is a specific protection, while installation of toilets or latrines, that is health promotion, right? Yeah, wearing helmet, vaccine, all those are specific protection. Okay? And then finally, secondary. Secondary is where you do, what do? You do screening, diagnosis and treatment. Diagnosis, treatment. Okay? What about tertiary? Now, tertiary is rehabilitation. Okay? Rehabilitation. What about my glasses? What is my glasses? Primary, secondary, tertiary. My glasses, what are they? The glasses that I'm wearing, what are they? What are they? Very good. So rehabilitation plus disability. Okay. So can you see why is it tertiary? Without this, I can't even look at the camera. So, ma'am, disabled hai. Like in a way, if somebody attacks me and my glasses fall down, can I recognize that person? No, because I'll be like, "Ah, I can't even look at you." So yeah, my glasses are very helpful. They are helping me rehabilitate against my blindness. Okay, so yeah, very high power. What about this one? Again, easy question. Yeah, tertiary because of disability. Very good, very good. Yeah, Shiva, yeah, there was actually, yeah. I'll tell you some stories when now we have enough time. I can tell you stories. So, yeah, I can tell you good stories. I have very nice stories where you will come to know me more and you will come to know what an idiot I am. So, yeah, anyways, let's go further. Research was conducted. Again, this is your case control. Why? Because where is the keyword? Yeah, history of social media was taken. Okay, history of okay, Shiva, don't tell all the secrets. Yeah, case control. Okay, yeah, very good. In different types of graph, the secular. See, this is your June 2022 question. फैजान को भी पता है, सबको पता है क्या? Yeah. What is this? What is this? What is this? Yeah, very good. See, we did this question. Line diagram, why? It represents secular trends going up and down. Remember COVID. Okay. Now, definition of blindness, it is the definition of social blindness, which is C. It is ma'am did not give Inicet. Okay. Ma'am is in a very deep depression because I don't know what to do with my life. So I'm still thinking whether I should. Actually, I gave PLAB. Okay, I gave PLAB. I cleared it, and then now everybody is like, "Why are you in India? Like, why don't you go to UK? Why are you staying here?" So, tab tak I was preparing for PG, and then I stopped preparation. And then I was like, "Oh my God, what should I do with my life?" So I still don't know what to do. Okay, yeah. Anyways, it is 3/60. Very good. Now this one, tell me the answer for this one. Again, easy question. I didn't write INSET. I didn't go for the exam. I just didn't care anymore. I don't know whether I should stay in India. I don't know. Yeah. So can you see there is a maculopapular rash? Okay, maculopapular rash, and we have a triad of measles where it is conjunctivitis. I'm sorry, conjunctivitis. What is it? Coryza. Coryza. What is the this thing? What is a triad of measles? Yeah, it starts from behind the ear. And what is a triad? Ajay, ma'am is not good in reading that much Hindi, na? Yeah. So what is a triad? You have coryza and what else? Don't say like that. See, we are all same. Okay, I never felt like your ma'am. I feel like a friend. Okay, more. Now tell me what is a triad of measles? What is a triad? Am I getting the chat late? Yeah, the answer is measles. You can see the maculopapular rash, and we know the incubation period. It is 10 to 14. And what? Yes, cough, coryza, conjunctivitis. Very good. Cough, coryza, conjunctivitis. Okay, this is a triad. The other thing is, wait, what is the other thing? We know the Koplik spots of measles. Where do the Koplik spots come? Can you tell me कॉप्लिक स्पॉट्स कब आते हैं? कॉप्लिक स्पॉट्स, it is in the second lower molar. Okay, even that has been asked. Lower molar. कैसे मतलब how do they make questions like this? This is so stupid. How does it matter whether it is upper molar or lower molar? Okay, yeah, so it is second lower molar. All right. Yeah, it is like this is the second lower molar and it will be on the mucosal part. Okay, I can't. So this part, all right, this part inside near the second lower molar, right? And what is this for measles? What is the this thing that we use? Yes, yes, but that is not pathognomic because many times it doesn't even come, right? Okay. Now, mumps we already did. Tell me about this. Again, very, very important topic for your PSM. And you must have noticed we have done so many questions related to different topics, right? And we covered a lot of questions in 2 hours. So tell me, which one has the most priority? Which one has the most priority? Yes, very good. It is first red, then yellow, then green, then black. What is your red? What happens? Yes, it is life threatening, but you can save that patient. You can save that patient. It is life threatening, but you can save that patient. What about a patient who has what do you say? Who has a life threatening disease, but even with operation, you cannot save that patient. So that not expected to survive, half of that person is cut. Will you run behind them? Will you try to treat them? Only do what is in your hands. ठीक है, आपके हाथ में पढ़ाई है, मेरे हाथ में कोट है, तो whatever I can do to help and save, that will become red. After that, yellow, it is not life threatening, but illness is there, but they can wait. That is the main thing. Minor is green, and if not expected to survive, almost dying, all those is black. Okay, so yes, green is ambulatory. Green is ambulatory. Now look at this. This is a very good question. I like it so much. Tell me the answer for this. Tell me the answer for this. Yeah, in war it is reverse. Okay, but we are not going to war. We are talking about medical, right? This is triage. Triage. They will not ask you about war. They'll ask you what is going on in the hospital. Okay. Yeah. So what is the answer? Yes. Usage of, see what happens if you have a vasectomy. You still have sperm left. And that's why you should not ki ab ho gaya chalo, no condom. You should not do that. You should tell the patient ki bhai, थोड़ा सबर रख लो, इतना सबर रखा है, do it with condom. You still have this thing left. Okay. So yes, it is either 3 months or how many ejaculations? How many ejaculations? How many ejaculations? Can you tell me? It is 3 months or how many ejaculations? 30. Very good. It is 3 months or 30. So if he itni jaldi mein hai, to ek baar, every day one time you do. So in 30 days it will be over. Or you wait for 3 months. Okay. So I remember it like that. Ki you remember, like you do it for 30 days, it's over. So remember it like that. पर मुझे नहीं लगता रोज ऐसा करेंगे कोई. The other thing is, what do you have to remember? What is this? 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 So I'll tell you the mnemonics, okay? This, what is this? Very good, very good. This is wrist drop, okay? Wrist drop is radial nerve. The other thing is jiska khada nahi hota, okay? The person who is not able to lift it, right? So that, which is the drug which is like this? Sildenafil, right? Sildenafil. And the other thing is, which drug which you do not give with sildenafil? That is nitric oxide. So with just my hand, I'll remember so many questions, okay? And the other thing is, okay, what is this? What is this? This is, I'll show you. This is premature ejaculation. Okay? So less than 1 minute. Even this is a question, okay? It has been asked. It has been asked in our exam. So premature ejaculation, less than 1 minute. And what is the drug of choice? It is depoxitin. Depoxitin. Okay? So I remember it like this. Radial nerve, wrist drop, khada nahi hua, sildenafil, Premature ejaculation, less than 1 minute, depoxited. Got it? With your hands only you can do so much. I like it. All right. चलो हमने 4 क्वेश्चन सॉल्व कर लिए एंड दीज आर द इमेजेस वी आर डन विद द सेशन सो दिस इज योर जॉन स्नो ओके जॉन स्नो you remember what is this now you answer me and answer fast ठीक है answer fast सब हंस रहे हैं okay this is your triad or triangle triad yes this is your triad what about triangle will include time okay triangle will include time then you have that model right where agents you will put causative agents like this thing that thing then you environment you will put genetic factors social factors all that okay so this is your triad if it is time then it is triangle okay triangle now look at this we remember the distribution 68 95 99 this is the negative skewed positive skewed then you remember this one this is your frequency curve this is your frequency curve okay this is your frequency curve. What about this one? This is your ogive. Okay, thank you for sticking for so long. See, we are ending PSM. Ogive, then what do you have? Histogram, line which is going up and down. Ogive goes only up, right? Then you have your scatter plot. Then you have box and whiskers. You remember the cat? Yeah. Venn diagram overlapping each other. Bar diagram, couple. So this is what? Multiple bar diagram. Then what is this? Component bar diagram. This is what one? Which one? Pictogram, everybody can see, even uneducated. Pie chart where nutrition related or percentage related. Smart map, geographical. Okay. Then what is this? What is this? This is your DOTS program, right? Daily observed this thing. You give the medication right there. And you should know the meaning of MDR, XDR. Nischay is the app. Okay. Nikshay is the app. Nischay was the pregnancy kit. Okay. This is the app. All right. You know MDR. What is MDR? MDR, do you remember? Thank you, Shagufa. Thank you so much. Okay. Thank you so much. If you really like the class, please do comment. Drop a like and comment. Okay, I mean, not in the live chat, comment in the comment section. Okay, I'm not good at this, dude. Yeah, multi-drug resistant, that means it is resistant to rifampicin and isoniazid. XDR is, it is resistant to isoniazid and rifampicin plus 1-fluoroquinolone like your ciprofloxacin and second line injectable, which is streptomycin, kanamycin. Okay, Nischay is the app. What about this one? Leprosy. I've written down the drugs. In paucibacillary, the treatment is given for 6 months. What drugs do we give? We give only 2. No confusion in this. Which are the 2 drugs? Rifampicin as well as dapsone. What about multibacillary? 12 months treatment. We give 3 drugs. Which are the 3 drugs? Rifampicin, dapsone and clofazimine. Okay? Clofazimine. Got it? What about this one? This is for your breast cancer. This is for your AIDS, right? National AIDS Control Program, your National AIDS Control Organization, right? So this is for AIDS. And when do we celebrate the day? Even that has been asked. So that day is 1st December. Okay? That day is 1st December. Got it? Now look at this. What is this? This on the machar on the top. Can you see the mosquito on the top? So this is your National Vector-Borne Disease Control Program, okay, NVBDCP. And what are the diseases that are included? Remember it very simply now and don't forget it, okay. So there are only 6 diseases. That has been a question and I've put every image was a question. So I did not take any images outside. You can check. These are done by mosquito, okay, and 1 sandfly. You remember like that. Okay, so sandfly for Kala Azar, the rest for mosquitoes. So malaria, dengue, chikungunya, filariasis, JE, they're all caused by mosquitoes. Those 5 diseases plus 1 sandfly, which is your Kala Azar. Got it? Okay. So these are the diseases included in which program? National Vector-Borne Disease Control Program. All right. Thank you, Verma Deepika. And this is your National Health Mission, right? National Health Mission. Before 2013, it was National Rural Health Mission and National Urban Health Mission. Now, after 2013, they have put it together and they call it National Health Mission, right? And what are the workers for this? That has been asked. Now it is Asha and Usha. Okay? Asha and Usha are the two most important workers. Thank you. Thank you so much. Okay. So this is your National Health Mission. What about this one? This is the National Program for Control of Blindness and Visual Impairment. Okay. National Program for Control of Blindness and Visual Impairment. Thank you, Success. That's why your name is Dr. Success. Yeah. Thank you so much. Thank you. And this is, I already told you, it is Integrated Disease Surveillance Program. Right? Sab ek dusre se. What about this one? It is Integrated Child. What is this? What is this? Ye bata do mujhe. What is this? ICDS. Very good. It is ICDS and you should remember what are included in this. Okay. So don't forget this. It is 0 to 6-year-old children, reproductive age female, pregnant or lactating female, female that is 11 to 18 years old, and it is controlled by Anganwadis. Okay. It is controlled by Anganwadis. This is your midday meal program, and proteins is taking more compared to carbohydrates. So 1/2 proteins and 1/3 carbohydrates, right? One-third calories, 1/2 protein and 1/3 calories. Okay. So this is due to human resource development. Remember this, don't forget. 1/3 calorie, 1/2 protein. I've written it down. Please go through this. Please go through this, okay? All right, yeah. Now this is your Mission Indradhanush. It's written there. मुझे हिंदी उतनी आती नहीं है तो पोषण पीएम, चलो मिड डे मील या पोषण पीएम या ओके ठीक है, आई चेंज दैट. पोषण अभियान हो गया आप, ठीक है, आई गॉट इट, आई चेंज इट. नेम चेंज हो गया बट सेम calorie is this much only and protein is that much only. Okay, Mission Indradhanush. What are the vaccines that they ask you? What are the newly added vaccines? You remember they are JE, IPV, MR, rotavirus. This question has come in the exam, so go through this again. All right, go through this again. Then what is this? This is your Iceland refrigerator. Okay, Iceland refrigerator. Temperature for vaccine as well as ILR is the same. It is 2 to 8. Okay, and there is a question where maximum chance of cold chain failure occurs. So remember, it is at the center and village. That is also the place where vaccines are not stored. So that's why maximum chance of cold chain failure occurs in sub-center and village. Okay, so I've written down all the questions that are important. Okay, this is your dial thermometer, this is your vaccine carrier. It can carry four, what four it can carry? It can carry 4 ice packs. Okay, it can carry 4 ice packs, and these are your ice packs. And remember, with the hole, 2 hole में 2 vaccines जाएंगे, ठीक है? So remember it like that, 2 holes, 2 vaccines. Even that has been asked. And reverse cold chain, remember, it is transportation of polio stool. You go there, collect the polio stool, and then go back. Okay, so that is known as reverse cold chain. And this is your vaccines, which can be used. So these 2 can be used. These 2, where the color is changing, we do not use it. Okay, so thank you so much for joining in. Thank you so much for staying till the end. I'm sorry about what happened with you, but I am 100% sure that we will stay strong. Okay, and I want you to do the same. I know this is very tough and you wanted to go home and you wanted to end your preparation, but चलो ले लिया और थोड़ा ले लिया तो ले लेने दो, और क्या ही कर लोगे आप, ठीक है? तो let's stay united, let's finish this, let's stay with each other, and let's study. Okay, we are with you. and you be with us. Okay, so one more thing, if you like the class, please comment in the comment section. Okay, that will really help me. Thank you so much, love you, and so sorry for whatever happened. बुरा फील कर लो, आज सो जाओ, रो लो, whatever you feel, but कल से आज मेरे साथ बैठ के we have done PS and PYQs. Now tomorrow let's do something else. Let's keep being motivated and message me. If you have any problems, this is my number. Okay, this is my number. Message me. I will make sure to reply it. Or you can add me on Instagram. I always, Dr. Sara 27371. This is my IG handle. So I am very, I use it very nicely. So if I don't reply on messages, I will definitely reply on Instagram. All right. So thank you so much. Let's end this session. Thank you. Love you people. Keep doing. Okay. Let's end this session. Bye. PDF group में. Okay. PDF in IL group. I'll send it. Thank you.